Hi everyone, my name is Kate Milliken and I want to welcome you to HIMSS 19 Global Conference. We're here in Orlando, Florida at the Orange County Convention Center, which is the second largest convention center in the country. We have 2.1 million square feet and 45,000 conference attendees. There is no doubt there is a lot to talk about in the subject of health. Before we get started, we have a few words from Ben Choder, President of West DMS.
Thank you, Kate. Good morning, good afternoon, good evening, wherever you might be joining from around the world. Today we kick off HIMSS TV, powered by West, live from HIMSS 19 in Orlando, Florida. We'll be broadcasting live from 9 a.m. to 12 noon Eastern over the next 3 days to HIMSS TV, HIMSS social channels, and even select hotel TVs. You'll be hearing discussions around consumerism, patient experience, and interoperability. Stay tuned for the latest trends in healthcare innovation, and don't miss my interview coming up soon.
So as we've started this conference, I've had the opportunity to sit down with two of perhaps the busiest people at HIMSS, Hal Wolf, who is the president and CEO, and Denise Hines, who is the Chief Americas Officer. I had a conversation with each of them. I'm here now with Hal Wolf, who is the CEO of HIMSS. Hal, I'm thrilled to have you on our set. 45,000 attendees, 1,300 booths. There's a lot of healthcare to be had. Tell me what you're excited about coming into this conference.
Well, every year when the global conference comes around, my head starts swimming, I think, about 6 months before it occurs. Because you have all of these challenges in healthcare that we all work with every single day across healthcare, health and wellness, mental health, behavioral science. And when you get this chance to come to the global conference, as you said, you're surrounded by 45,000 people who are thinking about health and wellness every single day of the year. And you finally get a chance to bring all these minds together, all these innovations, all these thoughts, all these questions that we get to sit, talk about, exchange, and have an opportunity to really be a part of a thought dialogue that takes place over the week that is the HIMSS Global Conference. And this year, of course, in Orlando. So we're thrilled to be here.
What are some of the trends that you are seeing here that are coming in this year from all of these people, ranging from entrepreneurs to large-scale providers? What are you seeing on a macro level that's important?
Yeah, I think the biggest change that's happened, and we started reflecting on it last year, was this shift from the technology to the use of the information. How do we actually grab a hold of all this incredible information, the data that gets turned into the information? How do we get our arms around it and start to use it to make better decisions in care, to go outside to the consumer, the patient, the citizen, back into the healthcare systems? These are unique times. This is a big change going on inside the industry. So how we think about the use of information, that's the cornerstone of what we'll be hearing about on a very big scale. Whether you're talking about the use of information for AI, whether you're looking at new rules around patient exchange, there are just a tremendous amount of focus right now around data and information. That's probably going to be one of the most important themes that we'll be talking about.
So with the trends that are coming out of HIMSS, including data, how does it affect the HIMSS members and the membership?
Well, being a HIMSS member is more than just a global conference. It's really a part of being a community that we have globally, whether in chapters in the United States or communities around the globe. HIMSS members come together all the time throughout the year to discuss policy and new trends that are happening. So when we have these new positions that are coming forward, as a HIMSS member, you look to HIMSS to learn, to exchange. You have a community you get to fall back on. And then when they walk in the door of the global conference, it's a pretty unique situation because most of them come here, we always say, with like 3 or 4 big questions or challenges that they have and go home with 6 or 7 answers. But because we're also looking forward, a lot like Gretzky used to say, skate to where the puck is going to be. They walk away with answers to their current questions and then things to think about in setting up what they're going to be doing inside their health or wellness environment, their own part of the ecosystem for what's coming up.
So in the past couple of years, one of the big buzzwords and important things that people have been working on is interoperability. So from your perspective, what changes do you think will happen in the next 2 years in that regard?
Well, let me take a step back a little bit. So I came up as a CIO inside healthcare, and if anyone who's ever worked with data inside this wonderful environment, you spend so much of your time and energy trying to create data integration. And this was just to have applications talk to each other. Now we're looking at taking devices from consumers. We're looking at large-scale applications that's producing the information that we spoke about earlier. We're looking at accelerated levels of clinical decision support and knowledge management. All that takes information that has to be able to exchange itself. So for us to be able to fulfill the promise of engagement, patient engagement, and capabilities, we really need to have interoperability. The faster we can free up that exchange, the better. So the focus point on interoperability has been gaining a lot of momentum in the last 2 years because we're getting closer and closer with opportunities like HL7 Fire, the use of Continua. There are standards that are out there and we need to continue to refine them. What's going to happen, I think, in fact, even here this week while we're all together at HIMSS, is there's going to be announcements made in the US side of the house, which are going to be talking about new data standards and requirements, all designed around interoperability and forcing applications and different providers' systems to be able to work together.
Wow.
All with a designed approach of ensuring interoperability so we can have faster connectivity. And this in the end will improve access. It'll have an impact on geographic displacement where people cannot get good coverage, whether you're in a city or in a rural state. They're just profound impacts. And it'll also have a big lift and impact on the consumer side of the devices because now more and more information can be drawn into the process.
And who decides those standards?
Well, the standards will go through the normal environment where we will start with rules that will be proposed from the government. And those rules will be looked at and asked for commentary. And then that commentary will be informed. HIMSS will take a part of it. We'll listen to our members. Other organizations will respond back to the government. And we'll try and find the right blend because I think we all know where we want to go. The question will be the detail and the speed and how quickly can we do it as an industry.
So you are kicking off this conference by being part of a panel that pertains to the subject of consumer-directed exchange. Can you define first what that is?
Yeah, well, this is a phrase that has popped along, consumer-directed exchange. And at the heart of it is how does the consumer have control over access, use of their information? How do we ensure that consumer information as a patient or an individual is exchangeable? So this gets all back to the interoperability question that we were talking about before. How does that data get put into the care continuum? How do we ensure that data isn't blocked and that interoperability can occur? And how do we lay this foundation for devices and outside information to make its way into the care continuum as well? So we put the consumer edge on it because it's so important for individuals to have access to their information, to be able to recognize where it's being used and how, and start to have more input, a little more control, and a little more ownership, not in the big O sense of I have to own all data, but O in the sense of ownership of the fact that it's out there and be cognizant of it, and it can all be used to improve their health.
And also, in other industries, right? In theory, if you're a consumer, you have the ability to kind of make decisions based on personal data and personal choice. And it sounds like the healthcare industry, this is something that is a work in progress comparatively.
It is, and I think it's a work in progress as it is in every industry. So when we look up today and we think about what we call in media, social exhaust. What am I doing on the web? What sites am I looking at? What phone calls or products or services do I buy? so much of what is brought to us from an advertising standpoint or a sales standpoint or products and services that are brought forward are really based upon our own interests.
Yeah.
And that information is collected from a number of different avenues. Health is no different. 40% of what impacts our own health is our personal behaviors. So if you limit health information strictly to clinical data, you're missing the biggest portions of the information that affect you as an individual. So this is why figuring out how we can bring all of that type of information to bear in conjunction with the consumer, that's a big step.
Right, and the holistic approach and best practices and figuring out and believing that will improve one's own experience as well as their own health.
If we do it right, the answer is yes.
Yes.
And we are learning how to do that. And there's a debate. And part of that debate is, well, how will the consumer actually engage? Because consumer engagement is in the very beginning of this experience. And a lot of people have looked up and said, gosh, the consumer won't engage. I can look at someone who's a diabetic and say, don't eat that bag of potato chips. But they'll eat it anyway. Well, that's true.
Yeah.
And let's assume that 2 out of 3 will go ahead and be bad patients and eat the bag of potato chips.
Right.
But if we can reach the third that do not, then that has to recognize as our success.
Or accept moments of weakness and kind of work around it. Maybe you only get 1 bag of potato chips a week, right?
That's right.
And that's better than 7. So I do think that's an ongoing conversation. What's your advice to IT leaders on how they can enable that change?
Well, I think the first point to IT leaders is understand from a strategy standpoint where your company is going. So it's not about putting in technology. It's about people, process, and technology. It's about finding the capabilities, the information that match the business architecture. So if you are a provider and you're on the provider side, what is your specialization? How do you plan on using patient engagement? Are you looking at telehealth? Are you thinking about remote sensors? Is your specialty in pediatrics? Is your specialty in home aging? Is your specialty in mental health and behavioral science? What is the business model that you're looking for? Then go back and figure out what is the information that you fundamentally need in order to execute it, and then to begin the back end system of where that's going to come from. But at its most basic level, think outside in, no longer inside out.
Wow.
Meaning recognize that the data and information will be coming from outside your hospital, outside your clinic, outside of your environment, as much as what you've always produced inside. And that is the biggest shift that's taking place all across the ecosystem.
Right, and not only for the data side, but also a patient, meet the patient where they are.
Absolutely. I mean, the way that a patient's going to get engaged is to engage them without even realizing it.
Right.
If you force someone to do it. You think about all the success in apps that we all use on our phones. It's not because someone forced us to. It's because it was interesting enough and beneficial enough that I launched into it. I started using it. I tried it. So I think the same thing's happening in health. And of course, there's tens of thousands of apps that are designed to move us in that direction. But now we're talking about integration of devices. We're talking about far more complex uses of information that impact your care and your treatment, and they're all starting to be blended into what we have on a daily basis right in front of us.
One of the pride points of HIMSS is the fact that you guys are a global organization. And I'm curious if you could speak to the global connectedness that's happening as a result of the work that you guys have done.
Well, we are, as you say, a global organization. And there are a couple of critical points. So first of all, this is the second year that we have changed the name to the Global Conference. Over 90 countries will be represented here. We have credentials coming in from media all around the world. Because the reality is we're all solving exactly the same problems in health.
Doesn't matter where.
And so great ideas come from many different places. They come from Asia, they come from Europe, they come from South America, they come from the Middle East, they are born from the needs inside Africa. How do we take those ideas and creativities and put them to great use in North America?
Right.
And of course, in North America, we're producing some of the most astounding products and services that are generated out of Silicon Valley that go ahead and put money behind the creativity that's taking place in hospitals and clinics all across North America. So this is that opportunity to share with each other.
Yeah.
And that's what we've been working very hard on. So you'll see more and more panels mixed with people from overseas and domestic. There's really a blending taking place.
It's cool to think also that global, people of different cultures, and as a result, maybe they come at similar problems from different angles. And also that no matter where you are, that we're all humans, right? It brings kind of a level of humanity to the whole world of patient care.
Well, and this is fundamentally behind the entire point. That our number one goal and the vision is to literally improve the health of every single human, no matter where. No matter who you are. Last question for you, Hal. I'm a reporter, so I did some digging. I have heard that there's a story about Bandit the dog, and I'd love for you to give the anecdote about it, because it sounds like it's a good representation of the world. Well, it's a picture I've been using for many, many years. 17, 18 years ago, my son, Adam, met the family dog, Bandit. And I was able to capture the picture at that exact moment. And it was a lovely picture. And hopefully we'll get it and it can be shown. But the point that was hitting me very hard at the time is that about a week later, we had our new dog in the house. And we started getting a request from the dog's doctor to make sure that he came in for immunizations, heartworm medicine, follow-up, and treatment. And our son was not getting the same notifications. Request and notification. In healthcare today, we call these registries. And we use these registries to outreach to patients to bring them in. And many facilities are just getting their arms around the use of these registries. The importance of them. Yeah. And yet 17, 18 years ago, our vets were doing a better job with the family pet than our own doctors at that time were actually doing with our own children. So it just shows you this measurement. And globally, as we look at the use of population health, we set targets, we send reminders, and that's at a mass level, much less at a personalized level. And we get excited that we've made headway. We also need to take a step back and realize we've got a lot of catching up to do. Well, and I'm going to assume that your son is healthy and wonderful, which makes you a proactive caregiver. He's doing really well. Great. I'm glad to hear it. Hal, I want to thank you so much for joining us here at the desk, and it's been a pleasure having this conversation. Well, thanks you, Kate, and appreciate you and everyone at HIMSS TV. It's been wonderful. I'm here now with Denise Hines, who is the Chief Americas Officer at HIMSS. Denise, I'm really happy to have you here, and I'm deeply curious about your title because it's so awesome. Tell me about Chief America.
Oh, wow, I have an amazing new role here at HIMSS, and just basically in my new role, I'm in listening mode, listening to the chapters, listening to the members, listening to the staff about how we can further the mission and vision for our organization. So it's an awesome new role, and working with professional development, the chapters, and just an amazing opportunity to support the global conference. I know that one of the, besides the chapters as their own entities coming together, women is something that you are very interested in, healthcare IT. From your perspective, is there really a glass ceiling? Well, it's just as you mentioned, in my role as Chief Americas Officer, I am over the Women in Health IT initiative. Yeah. And yes, there is a glass ceiling, and HIMSS is uniquely positioned to help women understand the glass ceiling and find ways to literally break through the glass ceiling. So working in professional environments, we realized, even through doing some research, that there is truly a glass ceiling. Yeah. And in some cases, women aren't sure how to break through the glass ceiling. Can you give an example of something that you've seen that really makes it clear? A discrepancy or? So what we've been able to find, and this is much of the work I've done with HIMSS as a HIMSS member working to support the Women in Health IT initiative, we found that women tend to hire other women, men tend to hire other men. And when we look at the percentage of men who are in hiring positions, they're hiring men, women aren't necessarily in positions to grow in the organization. So that's an example of how the glass ceiling happens, that women tend to hire other women, men tend to hire other men,
Yes.
and if women aren't in hiring positions, then they don't have the opportunity to necessarily hire other women.
So I have been a solo technology entrepreneur in the healthcare space, and I have felt some level of the pain you described.
Oh, yes.
One of the things I loved reading in one of your previous interviews is this whole idea that you can actually make a choice to find ways to empower yourself. So one example you gave me was, if you work at a healthcare IT company and you want to know how much somebody makes, ask.
Yes.
Right? And it is really weird that for some reason there's kind of a passivity or politesse. And I really appreciate the idea of you, thinking through this and bringing it to the attention of kind of the community. What specifically do you tell HIMSS members who are women on how to empower themselves?
Well, we have a couple of opportunities as women. We tend to be the caregivers of our family. So we tend to focus on our family needs and end up putting our career needs second. So we have to work with each other and the organizations to ask for flexible schedules. We can ask for support to leave work early sometimes and come in later, telecommute, and sometimes we just need to ask. And then in other opportunities, learning how to negotiate, understanding our value that we bring to the interview.
Right.
That we have to understand that a position should be priced at a certain level versus...
No matter who you are.
No matter who you are. And there's a certain range for that position. So instead of thinking, oh, I'm coming from a position where I can make 20% of what I'm currently making, what is really the value of that position?
Right.
And ask
and
for that.
Finding out, doing the research, asking for it.
And it's easy to do the research now. In the age of social media, Googling, just Google what a typical position is, but also using some of the resources we developed at HIMSS, salary ranges, the networking that's around us. Find someone who is doing that position for another company and just ask, what is an appropriate range for that position? But I think as women, we don't ask, and we are uncomfortable about asking and positioning ourselves to be in a be strong in negotiating. So we need to work on those tactics.
Super cool that's something that you're trying to promote for your constituency. What advice would you give for a woman startup entrepreneur?
I would say...
Please say, do it!
First of all, do it. We have so many examples of women who just step out and work on minimizing risk. Understand what your risks are and your fears. Why are you fearful? And list those fears and tackle them, face them, figure out how to get around them. And sometimes fear can help drive you. Fear of failure helps drive many successful people, but also mentors. Find a mentor. There are so many women now, even men who have started companies who can show you the way. Hire professionals around you who can show you how to financially manage your business, legally manage it, and create a circle around you of professionals who can help you be successful in your business.
Well, I can say as a startup entrepreneur who did reach out and find fellow entrepreneurs and mentors, I really think women want to help. So I think that's an amazing, amazing advice. Thank you so much, Denise, for being here.
Thank you, Kate.
So at this conference, we have a range of people from HIMSS roaming the floor. We have reporters, we have video editors, and we have writers, and now we have Beth Jones-Sandberg, who is going to be interviewing David Metcalf, who's the director of METAL from the UCF Institute for Simulation and Training.
Thank you, Kate. We're here at the Intelligent Health Pavilion with David Metcalf. Now, David, you actually run a technology lab at the University of Central Florida. So tell me a little bit about that first.
Sure, yeah. So I run the Mixed Emerging Technology Integration Lab, which is part of the Institute for Simulation and Training. And we work within the healthcare space, working on all sorts of medical simulation and healthcare simulation, as well as other projects. And one of the things we were asked to do here by the Intelligent Health Pavilion organizers and the Intelligent Health Association was to put together a new feature of the large-scale simulated hospital that the Intelligent Health Pavilion represents. This one is called the Virtual Medicine Lab.
So we're standing right in it.
We're standing in it,
All
yeah.
right.
And we've actually pulled together and curated some of the best technologies and some of the best organizations that are doing things with virtual and augmented reality. Some of the organizations that are here represented are Advent Health University, Mayo Clinic, Microsoft, Google, a number of other companies too, all showing some of their best examples of healthcare using virtual and augmented reality.
Well, a picture is worth 1,000 words, so take us on a little walk through some of the technology you're talking about.
One of the things we're going to be showing a little bit later today in a keynote is a kind of a breakthrough for us. It's combining some of the low-cost EEG for a brain gateway with the HoloLens from Microsoft. So you in essence have thought-controlled augmented reality for surgeons and for others. So those are some of the things that you're seeing here as well too on the screen. We're also showing another project that we've been working on with the Navy. And this is for all of the Navy corpsmen who are like the medics in the field. And the work that they're doing, this is a trainer that they can use to practice some of these life-saving skills that they might have. We always think of on the battlefield, but they're also some of the first responders to the disasters all across the globe, too. So these are skills that are used all the time, too. So those are a couple of the ones that we're showing. This is with Magic Leap, one of the latest Florida innovations, too, and also with some of the work that we're doing with Microsoft and the HoloLens.
And we have some technology laying right out here before us, so why don't we kind of shift over just a little bit and you can tell us about what these tools are.
Sure, so this is actually the Microsoft HoloLens, and if you combine it with one of these two brain gateway interfaces, then you actually have that thought-controlled augmented reality too. So the software to connect the dots between those two is part of what we were showing there too.
Okay.
And then this is one of the newest devices, the Magic Leap. And Magic Leap is also you call it kind of a hologram viewer, an augmented reality viewer too, that is starting to be used in a number of different settings. So those are some of the ones you might expect to see if you decide to come and take a tour of the Intelligent Health Pavilion later today, and in particular, the Virtual Medicine Lab.
This really looks like groundbreaking technology. How exciting is it to be working on projects like this, to be a part of things that could really make a difference in the future, and especially in the military? It seems like that's a major theme here.
We're having fun with this, and we also know that we're hopefully doing some good by giving extended practice to our medical professionals before they start working on patients too. So hopefully that will improve the quality and access of care and make sure that our doctors are not just trained to minimum competency, but to full mastery. I think that's the power that simulation in general can unlock for our doctors.
Absolutely, and we see simulation in so many other walks of life as a means of training, so why not with tools like this as well?
Yeah, absolutely, too. A lot of the work that we've done over the years, the Institute is over 35 years old, has been in things like building some of the first flight simulators, and then taking what was learned there to build some of the first mannequins that are used for simulation. Even some of the examples of these surgical robots and the trainers for those too. Some of the technology comes out of the fine research that's been done by our government and by the military for so many years.
Absolutely. Now, I know that there's something else that you're excited about, kind of hiding on the end of the table there. New book on blockchain in healthcare. So tell us a little bit about this.
So HIMSS has actually decided to put together a book on blockchain in healthcare. Our little team has helped build a number of other book projects for the HIMSS media over the years too, with mHealth and Connected Health. And this one in particular we're quite intrigued by because there's so much chance for blockchain to fundamentally change the way that a lot of the business transactions within healthcare are developed, and that's one of the things that we're most excited about too. So we have 5 authors too, some of the top names in the space too, that have helped curate 50 different contributors, some of the best examples of early work within this area, whether it's for medical records or whether it's for keeping track of logistics or keeping track of a doctor's credentials, even what you might do in the future with smart cities and with gaming and other areas that could influence healthcare overall. Those are all packed into this 500-page book that we have here too.
So a very diverse array of minds and contributors going into this book.
Correct, too, and it's been great to see some of the early examples. So it starts with some of the history, and then it goes to some of the most current cases too, example use cases too, where people are actually doing things with this technology in CMS, actually doing some work in these areas with some of the different groups, and then also an eye to the future. So those are some of the things that you'd expect to see in the book.
Also, one last thing, seems like an obvious question, but super excited to be here at HIMSS 19.
I am always excited to be here at HIMSS too, with you guys too. It is the event for healthcare and technology too, and I can't wait to see what's going on throughout the conference and on the show floor and in the sessions.
All right, well, David, thank you so much for your time and your insight. We really appreciate it. Kate, we're going to send it back to you.
Beth, that was amazing. It is so incredible to see that all of this stuff is real, and you have to remember that that booth is just one of 1,400, so the activity is crazy. And in fact, if you look around, what I'm seeing outside of the studio are hundreds of people walking, going up escalators. The conference has certainly started in earnest. And HIMSS has had the ability to put out a show daily, which is kind of giving us surmising of all the things that are happening here. It is vast, and it's been really exciting to see this range of people and all the activity that's happening. So next we have James Hellawell, who is an MD, MS, and a medical director of Care Transformation Information Systems. James, I'm so happy to have you here to talk a little bit about your work. And one thing I know that you have been involved with is the opioid crisis. So tell me about how the opioid crisis has kind of come about and what you guys are working to do about it.
Sure, yeah, Kate. So, you know, the opioid crisis is something that we're all struggling with across the nation. And at Intermountain Healthcare, we've been focused on that, and we're looking for the different ways that we can help prescribers to handle this situation in a way that will reduce the risk to patients, to reduce their exposure to opioids and their addiction potential.
Can you talk about how the opioid crisis is actually affecting the healthcare space? Because I think when you read about it or whatever, you really hear more about the people who aren't part of the healthcare system, who are living the problem. So how is it in there?
Yeah, you know, it's very personal, I think, to the healthcare space. Providers and all of the healthcare caregivers are really interested in helping patients. We want them to be treated when they have pain. But some of the things that we've been doing over the years have led to too much exposure to opioids, which puts people into a situation where they can easily become addicted to those substances. So it's very personal, I think, to the healthcare space.
So what are some of the things that you guys are able to do to kind of siphon that potential addiction off?
Yeah, so I think, you know, some of the big things that we can do is change our culture. We need to change the way we think about treating patients' pain and looking for other ways that we can do that without exposing them to these high-risk medications. And there's a number of different initiatives that we have in place to help shift culture and to also support that shift.
You know, it's funny, one thing that I heard, there was a kind of symposium yesterday about opioid addiction, and somebody mentioned to me that doctors are actually taking steps to try to shorten the amount of dosages that they're giving and making it very limited and almost trying to hit it before it starts.
Yeah, that's true, Kate. You know, we've done surveys at Intermountain Healthcare to see really how much pain medication do patients need after surgery, for example. And we often prescribe more than they really need. And if we can cut that back to an amount that's more appropriate, we reduce the risk of addiction and opiate overdose death.
And in your work, do you actually use information, informatics, stuff like that to help you understand what paths to tread? Because obviously that's a big deal here.
Yeah, for sure. You know, we look at our data, we look at our prescribing habits, we look at the way that our defaults are set up in our electronic health record system, and we've made changes to that to help curtail some of this issue.
What are you most excited about being here in terms of what you see at HIMSS 19?
Yeah, you know, I'm really excited about the things that I'm going to be able to learn, see what's coming in the future, see how we can really network and work together, put our minds together to do something bigger than we could do by ourselves.
Yeah. And the interoperability theme here that's been happening, have you yourself seen progress as someone who's ensconced in it?
You know, interoperability is a tough challenge, but I think we are seeing progress, you know, and that's going to be critical because no one organization can really handle all of the you know, technical pieces that are needed. We need to collaborate, which requires that interoperability.
And it's funny because I think that once you open one door, close one door, another one opens, so it's an ongoing process.
Yeah.
James, I really, really appreciate you being here.
Sure, Kate,
Thank you.
thanks.
Thank you. So certainly seeing this kind of medical perspective to the opioid crisis, I think is important to understand, and actually ideas of whether or not you can identify patients who are coming in who may have a problem before they even start having an addiction is something that I also heard talked about yesterday, which was super interesting. I'm here now with David McSwain, who's an MD, MPH, FAAP, and the Interim Chief Medical Information Officer at the Medical University of South Carolina. So let's talk information, David. What are your thoughts about it, and what are you excited about here?
Well, Kate, I'm really excited to be here. HIMSS is obviously the top place to be in the world for a discussion of health information technology and how it applies, how we can revolutionize healthcare. My focus in the talk that I'm giving this morning is on the real challenges of telehealth adoption and the way that we can rethink how we're approaching the development of telehealth programs to improve adoption and really improve our healthcare system across the board.
What are some of the obstacles? I mean, I can certainly speak from a patient, and actually I've heard in interviews in the past couple days, people have a concern that if you actually are on video, it's not personal. So how do you respond to that?
Well, the technology has really progressed to the point now where sometimes that interaction on video can even be more personal. And one of the programs, the very first program that I developed in telehealth was in pediatric critical care. Our program at MUSC in South Carolina provides 24/7 consultation services for critically ill children that come into community emergency departments. The normal situation you see there is we get on the phone and try to gather information about these critically ill children in these community emergency departments, and that can be very difficult. But when you have that video connection, you have a high definition camera, you have the ability to control that camera from wherever you are. You can move it around. It's like you're really virtually there in that emergency department, not only with the patient, but with the providers, with the community nurse, with the family, and you can make a huge difference, and we've seen some incredible impacts.
Do you feel like, you know, it sounds like the immediacy also of being able to turn it on and turn it off is huge.
Absolutely. I think the wonderful thing about telehealth is that it can be applied in so many different ways to impact healthcare. And
so give me a couple.
Yeah, so, you know, that immediate consultation, that emergency consultation is certainly huge.
Yes.
You've got
especially in a remote location.
Absolutely. It's an amazing way to address problems of access to care.
Yeah.
The other thing where I think is one of the greatest, provides the greatest promise for telehealth now, particularly with regards to the new CMS regulations in terms of reimbursement, is providing telehealth services into patients' homes for the management of chronic conditions, complex care, and care coordination.
Yeah. It's funny because before I came here, I saw the HBO documentary Bleed Out. I don't know if you've seen it. But there is a part of a man whose mother's hip surgery goes awry, and there is a virtual camera in the ICU, and it doesn't go well. What happens? And, you know, in that moment of actually being in critical care, you know, what could be the problems that come out? Because in that film, there were 160 cameras, all run by one operator in ICU, and it wasn't even noted in that example of whether the camera was on.
Right, and that's the key thing. When we talk about what are the real challenges of telehealth adoption, it's how do you transform practice and how do you do it safely? You have to think about what are the drivers of the need. And you also have to be very aware of the capabilities of your technology and how that technology can be safely applied in a given situation.
Right.
So you don't stretch the capabilities of the technology. You have to understand that certain applications of telehealth are appropriate in certain areas and others may not be.
Right, right. David, thank you so much for joining us, and good luck today with your talk.
Thank you very much.
Thank you.
Pleasure to be here.
Thank you. Well, in the days past, we have certainly talked about telehealth in the realm of actually psychiatry and physical therapy. And one interesting interview we had yesterday was with a physiotherapist in Australia who treats children. And she spoke about the fact that actually teenagers feel more comfortable having the telehealth. A, because it puts kind of a barrier, and also because they actually like to see themselves on camera as they're having their session. So there you go. You got lots of ways to go. With me now is Todd Dunn, who is the Innovation Director of Intermountain Healthcare.
Good morning.
Todd, tell me about what your focus is here in this conference.
Our focus is on connecting, learning more about the technologies and just the energy that's happening in healthcare and how we can harness that energy to make it better for the people we serve.
And talk to me about a little bit about how you and Intermountain Health do that.
We spend a lot of time doing work with our caregivers and our patients, trying to understand the struggles that they're having and to get a very good understanding from an empathetic stance. And once we understand the progress that they're trying to make, then we really go on a hunt to try to harness the world's knowledge to solve for struggles that people have in their context, whether the context is in an OR or whether the context is in their home.
Yeah, I think that yesterday we had Adrian Boise from Cleveland Clinic, right?
Absolutely.
And their whole mojo is empathy by design.
That's
so you can certainly talk about caring for the patient from your perspective. How do you actually bring empathy into all the different realms of healthcare? It's hard.
It's very hard. And at the same time, I believe that empathy is the heartbeat of healthcare.
Yeah.
And
well, it brings everyone down to humanity, right?
It connects us. It's what drives us and motivates us, I believe, to innovate in a way that's good for people.
Yeah.
The way to harness it, though, is to think about it from the way that we really deliver medicine. We have methods, we have processes, we have tools, and we have a language around it.
Yeah.
And I think with more structure that allows us to harness our empathy and passion to make a difference for people, that's the way we operationalize it, if you want to think of it that way.
Sure. And can you give an example of how Intermountain Health has presented one of those abilities to harness?
Yeah, we have a program that we call Design for People, where we literally teach people how to be lightweight ethnographers, where we go in and we do observations in GI labs, or we ride a bus with someone who's struggling to get to an appointment, or we observe surgeries. So that's one of the methods that we're working on harnessing in the company, is getting people out of the office.
Yeah.
And I call it the 3 C's of design disease: conference rooms, conference calls, and cubes. It's really hard to innovate if you're not with the people in their context.
Living it. And certainly when you're running an organization, when you make choices like that, that's a cost. So how much are you actually weighing the experience compared to the extra expenditure that you're putting out?
The ROI to that's really good.
Can you prove it?
I think over time, for sure.
Yeah.
One of the proof points that you'll have is the avoidance of bad decisions.
Yeah.
When we think back over the history of decisions that were made that were informed without the person being involved who was going to use the product or the service, and we've made a lot of mistakes. So I just think one point that we will see is that our time to wise decisions is much better.
Yeah.
And so you think about the time or not making bad decisions, that'll be a great ROI.
Yeah. So I live with MS, I'm a patient, and I really believe from my own experience that anytime anyone has chosen to lead with empathy, it has contributed to my healing. So I want to thank you, and thank you for being on the show.
Thanks for having me.
Cool, thank you. So yesterday there was an entire summit day on patient engagement, and Adrian Boise, who is at the Cleveland Clinic, spoke about empathy by design, and it was great. She showed this slide where she said, you probably think that this is empathy, and she put up a cute little cupcake with a little unicorn kind of peeking at it. as if it was really cute. And she finished her talk by saying, "This is empathy," and she showed this enormous picture of a bull. And her closing words of her talk was, "Be the bull." And I thought that was pretty cool. Hi, David Chu. How are you? This is David Chu. He's the CIO of Kansas City Children's Hospital. David, talk to me about your experience in your world and what you're seeing in the realm of empathy and patient engagement.
Yeah, well, I just left the role, so maybe I'm with a firm called Constellation Research.
Okay, good.
You know, I look at the mega trends between the digital world and the healthcare operations. So I just joined them last week. So when I look at healthcare operations in general, we really have to move towards a mass personalization to really a big focus on individual consumerization and customization of what the patients really want to look for. Big trend there.
Speaking of bull and a beast, right? Healthcare operations are pretty major. So when you're actually looking at those numbers and all the moving parts, do you see a way where you can actually start shifting it?
It's tough. When you just look at the way we're moving towards value-based care, a lot of buzz, lots of hype about it. But if you ask any major organization how much of their contract is actually based upon value-based care, still less than 60%.
Right.
So we're making that shift, but it's a long journey. I would say we're trying to get there, but the reimbursement model has to fit. And so, like I said, it's still a long journey to get there.
The other thing is that, you know, how do you quantify what value is? So what are some of the markers that prove to a bigger entity who has a budget that was a value success? Can you talk about that?
It's really looking at how are you going to the move in the future is keeping patients out of the hospital.
Right. Especially in 30-day readmissions, right?
Exactly. Very different model now, where historically, let's fill them in. So the model is going to be, it's all based upon numbers. How are you showing the positive revenue? But here's the challenge. A CEO has to go to the board and say, you know, the next 3 years, I'm going to make a big bet towards value, but I'm also going to be in the red. And that's a very bold statement, bold move that not everyone's willing to take. The progressives are doing it with scale, but most players are not. And I think that's a crutch, and that's not helping us get to where we need to be.
How do you feel that you working at a children's hospital has affected your lens for this new job?
You know, because, well, I look at the trends from the mega trends in the world, from technology. I look at what all the folks are doing in retail, financials, and now I'm able to apply from a healthcare lens. And the key is, how do you operationalize it? Most folks have trouble figuring out how to operationalize these mega trends and apply in a healthcare setting. So that's my focus now.
The other thing that's interesting is the whole concept of this now being the age of the consumer. And certainly you've seen that in other industries, especially if you're studying them. How do you take this one and make it that the patient has much more of a choice in light of what they're doing?
The key is understanding them.
Understanding
them outside the four walls of the hospital. We do a really good job at hospitals to know what they're doing when they're in our building, but once they leave, we have no idea. So the future is really understanding all the various data points, whether the social activities, the social determinants. I mean, you hear about all these things, but we don't understand what they're doing outside of the hospitals, and we need to do that extremely well to play in the value-based care game. And that's the struggle. Most folks are not thinking the omni-channel experience that we have in marketing. So being able to apply that, that's huge.
David Chu, I'm really excited that you are in your new role. I have to believe that this is a great way to kickstart it at HIMSS. Best of luck, and thank you for joining us on the show. Okay, a word from our sponsors, everybody. We'll be right back.
Enabled solutions that move your communications into the future. Patient engagement solutions that support you in solving the complex communication challenges associated with patient experience, patient care, patient access, and revenue cycle management. Digital media solutions that help you target the right audience, communicate across multiple channels, and monitor the impact of your messages. Visit us in booth 659.
Current Health. Okay, and what is it? Hi, welcome back. We are here now with Christopher McCann, who is the CEO of Current Health. Christopher, thank you so much for being on the show. Curious about what you're about and what you're working on.
Sure. So firstly, I'm clearly not an American. I'm from Scotland.
Yes, you are.
We're a software company who identifies higher risk patients at home earlier. We use this device to continuously and wirelessly monitor them, and then we use analysis on that data to direct the health system, the physician, the nurse, to the patient who most needs their attention, but at home.
So let's actually take a look at this device. I don't know if we can get a tight shot of it, but why don't you explain what this is, how you wear it, how it works?
So we put this on their upper arm,
okay.
And then we monitor them wirelessly across everything from their respiratory rate to their oxygen saturations to changes in their mobility. The idea is to get as many different metrics as we can to then analyze that in software to say this is the patient that we think most requires some kind of intervention, get the physician to them earlier back at home, and then stop them readmitting, produce a better outcome for that patient, and ultimately reduce cost.
Who gets it?
So mostly we're targeted at high-risk patients who've just been discharged from hospital, or who have multiple chronic diseases and who require long-term monitoring, so frequent attenders at hospital, people who are at risk of continuously deteriorating, and the system is financially liable to and wants to try and improve their outcomes and reduce their cost.
So one of the things you hear about people getting all of this amazing data. Oh my gosh, I have 14,000 pieces of data on myself. But it's not always a positive because it's overkill.
Yeah.
So how do you respond to that?
Well, I mean, that's why I described ourselves as a software company, not a wearables company. We did a wearable because it gave us a real-time data feed from the patient.
Yep.
But for me, that's a huge amount of information. What we try and do is not focus on the wearable, we focus on turning that into some kind of early warning alert that says, hey, this is the patient that you need. This is just a means for us to do that rather than the company as a whole.
Right, and do the patients actually want to access their own data?
They do. The most common piece of feedback we have from patients is, please show me my information. From our perspective, we think that's positive, but only if we also show them it with some kind of educational context so that they know, hey, this is my data, but this is what it actually means, and that's what action they should take, and can we then empower them through that, rather than just saying, hey, your oxygen saturation's 85%. I don't think that means anything.
And then they can go to the Google and probably freak out.
Exactly, and then they turn up at the emergency room, and that's just a loss for everyone.
Yeah, I had read once that Fitbit, which a number of years ago was all the rage, that the average amount of time that someone wears a Fitbit is 3 months.
Yeah.
And then they're like, wah, wah, So it is really interesting of this. Here's where you're at right now. Here are the numbers we have. Here's the context, and here's how we can do what we can do about it.
Absolutely, and I mean, we've got 92% patient adherence globally at the moment, which is sky high for our space, and it's because patients say they feel safer and more secure and that they feel protected.
That's fantastic. Well, Chris, great work. I look forward to you figuring it all out, making it that we can have all this data and you can pull what you need and make people better. Thank you for being on the show.
Thank you for your time.
Cool, thank you. So it is really interesting. I think one of the biggest insights I have is this whole idea that you are so lucky to have all this information and that sometimes it can really be overkill. And talking about APIs, ways of pulling the data, what Chris is doing is a really exciting way, I think, of starting to put it into context and allowing people to get how they can move forward better. Next in our show is Richard Milani, who's an MD, FACC, FAHA, and the Chief Clinical Transformation Officer, Vice Chairman of the Ochsner Health System. Say that in one sentence, in one breath.
That's a mouthful.
You sound really amazing and very qualified. So what is your focus here at HIMSS?
Chronic disease and using information technology to re-engineer how we deliver care for patients with chronic disease.
So tell me more about the technology you're using. I have MS. There are 133 million people in the world in the US that have it. So
well, we haven't started with MS yet. We started with more common problems, and we're working our way down. So we start with hypertension, and then we've got diabetes, and we've got COPD. And so we're using data collected from home, whether it be a digital blood pressure cuff, a digital glucometer, or even smart inhalers to give us information about how well you're doing, if you're staying in bounds, if you're heading out of bounds. And then we have a whole care team that's dedicated every day to receiving the information, managing your medications, and managing any lifestyle recommendations necessary for you to do well in your disease.
How do patients get on board with your program?
Yeah, so it's a physician order. It's a one-click order in our EMR system.
Wow.
Patients then get a message in their patient portal account. They fill out some survey data. We have all the information in the medical record. It's all done inside the EMR.
Wow.
And then we have a dedicated team, as I mentioned, of pharmacists and health coaches that receive the data and then use the current guidelines to manage medication management.
So we were just speaking to Chris, who actually has a device that is capturing all of that information and putting it into a software program. How much do you feel that patients actually want to know their data?
Well, I can tell you our patients certainly do. We actually send them monthly reports that shows them their progress or lack thereof. It gives them additional tips that they can do. Yeah. It's been our experience that patients are thirsty for the data. If for a chronic disease. Now, maybe if I'm just a healthy person and I just want to know about my heart rate or something else, I think that might be a different story. But if you have MS, COPD, or whatever, this is something you're likely to have lifelong. Yeah. You'd like to know where you're going and are you going in the right direction or are you not? And what you need to do to kind of stay in the right zone.
And also the importance of putting it into context, which it sounds like you having such a team of care providers.
Yes.
Really explaining what it means.
Well, I think it's more than just that. If you look at the national data, if you have a chronic disease in the United States, the odds of you being on the current guideline-based therapy is a little less than 50%.
Wow.
So what we're doing is actually getting 100% of our patients on the current guidelines.
Yeah.
So that by itself is a major step forward. Yeah. Secondly, physicians aren't well prepared to be able to manage behavior change and lifestyle change in a small office visit. Yeah. So we have a lot of time that we can provide to patients to do that. And then finally, it's difficult to manage a disease state that's changing every day or week by collecting biologic information 2 or 3 times a year. Yeah. We have to have a frequency of information that is commensurate with the change in the disease itself.
Yeah. I'm really impressed. You know, we've heard so much about EHRs, being implemented, and I've heard a lot about their limitations. What I think is really great about this is actually finding a way to add kind of additional services within the EHR. Yeah. Is that a hard thing to do?
It just takes some build. I mean, obviously this didn't come out of the box from the EHR, but if you have a team that you can dedicate to customizing the way you want to have your data and how you want to receive it, it's definitely doable.
That's great. Dr. Milani, thank you so much for being on the show. I really, really appreciate it.
Thank you.
And the world of chronic illness is one of the biggest tugs on our system, and I think it's amazing of finding ways to crack in on the individual level and figure out how to make people better, even at its onset of a 30-day remission or whatever else. So that was awesome. I'm impressed. Next with us is Beth Landon, who is the Policy Director for the New Mexico Hospital Association. Beth, welcome.
Thank you.
How has HIMSS been for you, and what are you looking to explore?
This is my first time to HIMSS.
Okay. So is this what you expected?
I was told to be prepared to be overwhelmed and to wear good walking shoes.
Good. Somebody actually thought one great way to deal was to walk around in a Batman costume. That happened yesterday.
I bet. Well, that was the opening reception, right? Okay. Action figures.
Uh-huh. Oh, I didn't know that. So there you go. Okay. So what are you looking to learn here?
I am looking to learn about new solutions, new technologies. We are very excited in New Mexico because we're working with Collective Medical Technology, and that's what I'll be presenting on Thursday afternoon.
And tell me what that is.
Collective Medical is an amazing company. They offer a two-pronged solution. I'm with the Hospital Association, as you announced, and their tool enables ideally informed care to the emergency department and concurrently proactive care coordination after the emergency department.
So walk me through that with an example of a patient.
Absolutely. A little background. New Mexico is about over 40% of our population is on Medicaid, which creates an awkward opportunity to rethink care delivery, and we certainly can ill afford siloed solutions. So the hospitals have come in partnership and collaboration with the Medicaid managed care organizations to invest in this product that enables when a patient presents in the emergency department and they meet the criteria of that hospital of frequent flyer, drug-seeking behavior, security risk, anything, information is immediately within microseconds pushed to the triage clinician so they can engage in an informed conversation, no longer acting as a TSA agent, but really saying, Kate, tell me about your headaches. Yeah. It seems you've been in a lot of emergency departments lately. Let's not repeat the brain imaging.
Right. Yeah, and what is the healing power in that to know that the medical professional that you come in contact with already is able to say, I know what's happened to you in the past X number of months. Let's take a different approach, or...
Exactly. And let's figure out what you need. Yeah. Let's not repeat these tests.
Right.
Absolutely.
And are there other themes? We've talked about data, we've talked about interoperability, we've talked about telehealth. the silver tsunami, these are all themes that are kind of floating around at HIMSS. Are any of these affecting you?
All of them are. Healthcare is changing so rapidly. I mean, we're all bombarded with vendors and solutions, and it's really figuring out the path and then what solutions enable that path to be the most successful.
And there are so many entrepreneurs who actually believe that they have a wonderful idea that can help you, and then having the medical team make that choice to adapt it. You know, talk about the time involved with that, and you know, how to get a rhythm on the floor.
Right, exactly. And that's another great thing about collective medical, because it pushes the information to the clinician. There's no logging in, trying to remember your password, all of that fumbling. It's just as you're walking, literally as they are walking to see the patient, they can read the one-pager.
Yeah. And have you seen and been able to prove metrics that show the efficacy of this?
The metrics have been proven more in Washington State, the only state that's that's ahead of New Mexico. For us, we're still looking at individual solutions, impact, results. But the volume of hits is high. The volume of messages that are being pushed is high. So we anticipate in the next few months we'll be seeing real changes. And nearly all of our hospitals have adopted the product now. We're down to the last 2.
Wow. Well, I wish you luck on your talk. And I'm really curious on when you look at today's agenda, what is it that you think you're going to look into?
Oh my gosh, there are so many things. I'm really interested in the Colorado HIE. Again, more of like collective medical, which is not an HIE, just how information is being shared as opposed to being siloed.
Right, and how much progress they have made in terms of at least putting in a medical record, right? And having electronic.
Right.
How is it, in your system in New Mexico, what are the oppositions that you face to getting that to unsilo?
Absolutely following the money, the bureaucracies, the systems are antiquated and used to doing things in a certain way. And having a shared vision and working together on a shared vision.
Wonderful.
And for example, with collective medical, we now convene every other month as a steering committee, payers, providers, different provider associations, and we're working together on where we want to take the product and take the solution.
That's great.
And that opportunity to come together and have those frequent conversations enables other opportunities to manifest.
And it's huge. Awesome. Beth, have an amazing time. Good luck. You're not wearing sneakers.
No.
I'll be
you
checking.
are.
I know I am. It's true. I learned my lesson.
You did.
Cool.
Thank you very much.
Thank
Kate.
you for being on the show. So recently I had a chance to sit down with Carla Krivet. Take a look. So with us now is Carla Krivet. Hello, Carla. How are you?
Hi, how are you?
Tell us where you're from.
I'm from Boston.
Okay.
I'm working for Philips. I'm the CEO for Connected Care and Healthcare Informatics.
Wow. So what will be
Actually, sorry, can I say that again?
Yes, of course.
I'm the CEO of Connected Care.
Oh, good for you. Okay. So what do you think will be front and center for Philips at HIMSS in Orlando this week?
So we are all about connecting care. I loved your comment on tele and telemedicine. So we connect patients, data, and information across the health continuum, all the way from acute to the home, including telehealth solutions we are very excited about.
So any big news that you want to share?
Yeah, we are going to launch the IntelliSpace epidemiology solution.
Okay.
It's a really unique solution tracking hospital-acquired infections, which is a big problem, right? Alone in the United States, 1.7 million hospital-acquired infections, accounting for 9.4% of the inpatient costs. So huge costs, and actually the death rate, more people die from hospital-acquired infections than from cancer and prostate cancer and breast cancer together.
Wow.
So
has that changed actually with the checklists being implemented? Has those infection rates gone down?
Yes, it does.
Yeah.
And also the basic stuff of washing your hand and so on helps.
Yes.
But the problem is that usually the infections you find out too late. So we did a trial with 2 hospitals, Westchester and UMass in New York, and we found that with our solutions we can find out 87% earlier, so 87% time reduction from the moment you actually know that you have a hospital-acquired infection, and then can trigger the appropriate action.
How does that reduction take place? Tell us a little bit how that works.
So we are, you have a dashboard, a very easy dashboard. We are working with the hospital-acquired infection control teams, and then they interfere. They isolate the patients. They go all the way using data back to the source of the infection and take the appropriate actions.
And what about the subject of AI? This is something that has been here buzzing at HIMSS for a while. Is Philips getting involved with that?
I think we don't have a single solution anymore which is not AI enabled right now. It's all, Philips is all about AI. Let me give you a concrete example. We always think of the ICU as the critical place in the hospital. Actually, we found out the general ward is far more dangerous because there's no continuous monitoring. The patient-caregiver ratio is not 1:1 or 1:2 like in the ICU, but 1:10 or 12. And up there we have patches, biosensors that catch the vital signs of a patient, do alarming, all based on AI, do triaging, and alert caregivers 6 to 8 hours before a heart arrest happens. So enough time to really involve the physicians to either bring the patients to the ICU or to give medication. And this smartness behind it is all AI.
Wow.
Also in our precision diagnostics space, when you look at the PACS system, they are all AI-enabled systems right now, not only looking at images, but combining it with genomics information, with pathology to an integrated solution.
Do you feel this type of work and these types of products is kind of the way of the world of healthcare?
I very much think it's a future. Yeah. We all know healthcare is too expensive and is often not reaching the right people fast enough and is not precise enough. Yeah. And using AI addresses these issues, getting to the quadruple aims of clinical outcome, but also lower costs and better access.
Yeah. Awesome.
Telehealth, as you just mentioned, is a great example. We have an EICU solution where you have a hub and spoke model, really using the best physicians and the best advice from a center hub, let's say somewhere in Bangalore, and then connecting to rural hospitals or even care stations around the country or internationally, applying the same standards of care.
Yeah, wow. Well, it's actually really nice to hear. You hear about AI, you hear about the way of these things happening, to actually hear something concrete that's working. Certainly
I couldn't agree more, because there's a lot of buzz about AI and everything's AI. Yeah. And I'm telling my own people working for a technology company, I'm like, hey, it's not about AI, right? It's not about AI for AI's sake. If you cannot prove the outcome, if it doesn't make the life of the physicians easier, if all they have to do is put more stuff into the EMR they'll never see again, it's no use. It has to be practical, and the proof of the pudding is what the physicians and the patients say.
Great. Well, it's really nice to have you, Carla. Thank you so much for being on our show.
Thanks for inviting us.
Well, it's certainly awesome to see all these products that are launching here at HIMSS. And in the past couple of days, I've had another opportunity to sit down with Bruce Steinberg, who is the Executive Vice President of International Relations at HIMSS. HIMSS is really into their global connectedness. They have a number of different countries that they represent. And Bruce has, as you will see, a lot going on. Take a listen.
HIMSS 19 is truly a global conference. International is definitely taking center stage this week with delegates from over 90 countries. We're going to hear insights and thought leadership from stakeholders from all over the world who have the same goal, to improve healthcare through innovation and the use of information technology. We're all working to solve the same global challenges in health, whether it's advancing value-based care, data sharing, interoperability, or privacy concerns. Through our regional summits, we'll be taking a deep dive to address the most topical issues in each region. The Latin American and Brazilian summits will address how professional development is essential to value-based care. From Europe, our Nordic, Swedish, Dutch, and French HIMSS communities will look at the latest developments in interoperability, data sharing, and privacy. The Asia-Pacific Forum will chart a roadmap for value-based healthcare. And for the first time ever, we will have international representation in our Interoperability Showcase, where Nordic shareholders will present some of their cross-border solutions that enable patient freedom in open healthcare ecosystems. We're also expanding our brand with the launch of Mobi Health News and Healthcare IT News in the EU and HITN in Asia-Pacific. What we're doing is framing thought leadership through the globalization of our two most recognized media brands, and that has been a significant milestone for the international community. It's absolutely critical for stakeholders to stay abreast of local, regional, and international developments. Our publications are meeting a need and a demand for this, establishing a platform where we can lead conversations around the healthcare ecosystem. What's so exciting is that these publications launched last October, and in that short period of time, we're already looking at expanding into Thai and German versions. So this tells us that our regional editions are really resonating. Another recent initiative we launched is a new ebook for the global membership worldwide, HIMSS Insights. This ebook series has also greatly impacted audiences. It provides deep dives on crucial subjects such as innovation and interoperability, and it's produced by some of the world's most knowledgeable healthcare journalists. I'm delighted to announce that this week we're launching our third edition called Global Innovators, highlighting Health 2.0 applications that could change the world of healthcare. HIMSS Insights reaches our entire HIMSS global network from Europe and the Middle East to Asia Pacific and the Americas. Also, I can announce that this year we're taking the CXO Dialogue concept global. What started out as a small high-level meeting in Singapore last year will now be present at every one of our regional flagship events, as well as our one-off gatherings. We found that most senior audiences really embrace the opportunity to contribute to a facilitated dialogue on key issues, especially when they can take real solutions back to their organizations. The concept was so well received that we're taking it to different cities around the world: Melbourne, Bangkok, London, and Sao Paulo. I'm so pleased to say our flagship events continue to grow. In the Middle East, we work with local ministries of health who support our UAE eHealth Week event in Dubai in March and the HIMSS Saudi Arabia conference in November. In June, our European flagship event in Helsinki, Europe 19, will be joined by Health 2.0 and will be the largest HIMSS conference outside North America. This year, the conference is receiving overwhelming support from the Nordic region and our 9 Finnish partners, and we expect to showcase some of our most innovative companies in the sector. In October, the Asia Pacific 19 conference will gather hundreds of healthcare professionals in Bangkok, and we have many other smaller national events going on around the globe. On a policy level this year, we'll have greater involvement in European stakeholder meetings with the European Commission and the World Health Organization. These are 2 key institutions driving change in healthcare through policies, legislation, research, and best practice. I've often been asked if there's one common digital health challenge that nations are facing worldwide. Interoperability and cross-border data exchange are definitely common challenges, albeit to different degrees. In Denmark, in Singapore, in Australia, or Russia, people are looking at the same problem: the use of digital information and extending it across borders. So, for example, in the last few weeks, citizens have been able to use e-prescriptions seamlessly between Finland and Estonia. A Finnish patient on holiday in Estonia can now fulfill their medicine prescribed electronically by their Finnish doctor in an Estonian pharmacy. The number one thing to remember in all of this is the patient-consumer standpoint. How does it make their life easier, and how does it get them better and safer care? Innovation is at the core in enabling digital transformation, and with the acquisition of Health 2.0 and HealthBox, HIMSS has moved deeper into healthcare innovation by providing unique resources, best practices, and global expertise, as you'll see at the Global Conference this week. As well, the HIMSS maturity models help providers understand their health systems better on a global basis and help them prioritize their use of resources to improve those systems. Also, we help drive workforce development by working to inform and educate through our media and workshops. Lastly, by convening local, national, and regional conferences around the world, stakeholders learn about best practices from their peer groups in order to drive better healthcare outcomes for their patients. And that's what we all want.
With With me now is Stacy Cummings, who is a program executive of MHS Genesis, Major General Lee Payne, functional champion of the military health system, and Pat Flanders, who is the Chief Information Officer of the DHA. Thank you all for being here. Obviously, the military is an enormous population, 9.5 million people. Can you provide an update on MHS Genesis deployment and the lessons you all have learned so far?
Sure. So MHS Genesis has been deployed to our first 4 initial pilot sites in the Pacific Northwest, and we've learned a lot of lessons from those 4 deployments. And I'm going to ask Major General Payne to talk a little bit about our lessons around training and change management, and then I'm going to ask Pat Flanders to talk a little bit about our lessons learned around the infrastructure that supports the deployment of an enterprise electronic health record.
Yeah, it's a big undertaking. It is. Major General?
We learned that our initial approach to training was really about which buttons to click, and we learned that wasn't the right approach. So the way we're approaching it now is more from a peer expert perspective. So, and I'm an emergency physician, so we have emergency physicians train emergency physicians, critical care nurses train critical care nurses, and we're building those peer experts now at our next wave sites. The other thing about this is it's a giant change management problem. We learned that we need to be able to show people what their current as-is workflow is, and then what is their to-be workflow, and then help them make that transition across that. It's a considerable journey for them to make that transition. So we're investing a lot more in our change management plan as we move into the next wave.
I feel one complaint I heard with the implementation of EHRs in general is that they had to come up so fast that there were a lot of UI issues, right? And the whole idea of actually bringing in peers to kind of circumvent that, I think, is strong.
I think it's going to be really helpful.
Yeah.
Yeah, it's not just a software rollout either. It's taking over the military medical networks prior to Genesis coming along. So those 4 sites you just mentioned are Army, Air Force, and Navy that are all on different infrastructure. So before Genesis can come along, we migrate them onto a new network. And what we learned was that after we migrate to that new network, there needs to be a longer burn-in period so that they're not going through the challenges of new software at the same time they're going through challenges with new network, new infrastructure, and how things work.
Right. We're trying to roll it out more methodically and slower.
Right. We've got about a 6-month period now between when the network modernization is complete and Ms. Cummings folks show up to begin the fielding of the software.
We also learned that connecting all the medical devices to the network well in advance and making sure those are working was critical. So that's one of our lessons learned as well.
Yeah, because technology is hard, and I always feel like in a time where you really need it, it often goes down. You speak about peer experts helping you. What about the functional community? How are they getting involved with MHS Genesis as it launches?
Well, I'm an emergency physician, and as I mentioned to you, and I remember documenting on paper in the emergency department, and I oftentimes would never have the patient's record available. So many times I think we perhaps miss things because the patient couldn't provide that information and we didn't have the record available. This transformation we're undertaking really is going to make that kind of care obsolete. And the functional community are really the frontline users. I get to represent their voice back to the program office and the network to help make sure that their voice is being heard. But they not only need to be engaged to make the transformation successful, they actually need to lead the transformation to really get us where we really want to be.
Anything else you guys want to add to that?
I agree. It's been a critical position, the one that Major General Payne fills as the functional champion. We've also established an office in the Defense Health Agency, the Chief Health Informatics Officer, who really understands the system, the MHS Genesis, as well as how it's being used in the military treatment facilities, so that he can actually, along with his staff, help us to make the best decisions for the configuration of the tool that we bought.
Yeah.
So we did buy a commercial off-the-shelf tool. MHS Genesis is made up of Cerner Millennium and Henry Schein's Dentrix. It's very configurable, and the functional community has the strongest voice in determining what that configuration looks like.
It's actually resulted in organizational changes as well. I mean, prior to MHS Genesis, in my CIO shop, we ran the training, the sustainment training for the systems that we have out there now. Well, we decided that we should take those trainers and move them over to the functional side of the house so they have that continuous loop of fielded system and feedback from the trainers on the ground so that we can continuously improve.
Well, I think the whole idea, I'm a tech entrepreneur, and you really start to learn how to iterate.
Right.
You know, when you're a solo entrepreneur building a platform and a minimum viable product, that's super clear. When you guys are coming in with the scale that you guys are dealing with, I think it's hard to kind of find your rhythm and find a process where, even though you guys are gigantic, that there is a way that you can, you know, iterate, learn lessons, and make it better.
The other thing I think we've had to do is streamline our governance. You've really got to be.
That sounds very difficult.
It is, but you have to be agile. The system is operating real time, and we've got to be able, as Mr. Flanders mentioned, we've created this organizational structure that is real time engaged with those sites and help them to solve the problems.
Yep. Wow. Cybersecurity is something that has come up a lot, I think, with EHRs in general. So how are you guys handling that?
Well, patient safety and protecting our patients' data are our two top priorities in the deployment of MHS Genesis. And so we have taken a layered approach to cybersecurity, and I'm going to ask Pat Flanders to talk as the Chief Information Officer at the Defense Health Agency to talk about how we're leveraging cybersecurity at the local site with our network infrastructure and medical devices, as well as back at the data center, which is hosted in Kansas City. And we're using the risk management framework to manage our risk, and we're being very proactive about continuously challenging ourselves and challenging our industry partners to put cybersecurity first, making sure that we're protecting that data while still delivering a user experience that is reliable and available to provide patient care.
So cyber at the facilities, like I talked about before, the different networks. Well, when we bring them into the new network, we move from 3 different security contexts to one set of rules. And cyber hygiene and the ability to connect the device is really a function of the device itself and the network. Well, since we're all on one network now, it improves our ability to do that and inherent controls. On the data center front, what we're doing there has never really been done before. And we have the top cover of the Department of Defense Chief Information Officer, who is the actual authorizing official for what happens there. And so we've made great strides, I think, improving with each enclave that we connect.
I'm just going to assume when you get to casually say the Department of Defense is working on protecting some stuff for you, that's probably a perk, right? So can you guys give me an actual example, anecdotal or whatever, of veterans that are being affected by this and how it's helping them?
So the patients that we see in the military treatment facilities are service members, veterans, and their families. So there is a large subset of veterans who are actually seen in a military treatment facility. But as you're probably aware, the Department of Veterans Affairs has decided that they are going to buy the same system that we are, MHS Genesis. And so the difference between having 2 systems where we are now and we exchange data by sharing data to a portal, by being in the same system and being in the same instance, we are truly putting the service member and the veteran at the center of the solution.
And does that happen a lot with other things, veterans versus active service members, or is this unique?
I think that what we're doing is unique in the federal government in that we are bringing together the 2 largest executive branches of the government and the 2 largest populations of patients, putting them in a single system. So whether you're seen by a military doctor or a Veterans Affairs doctor, they are seeing exactly the same information, and it is being updated immediately. And so when we finish our deployment of both the DoD and the Veterans Affairs EHR implementation, we will have really just more data, more up-to-date data, and from a patient care perspective, I'll let Major General Payne talk about the impact to patients, but we see this as a great benefit to our veterans.
Well, today, we transfer, people that serve in the military, they get transferred to the Veterans Administration. And today we transfer paper records and our legacy systems. We have to transfer all that data to the VA. As we move toward MHS Genesis, we're going to start at the military entrance processing centers.
Right.
MHS Genesis will be there. As they serve, they'll be cared for at MHS Genesis, and then as we transfer them to the Veterans Administration, all that data and all that care information will be available to those providers. So you can imagine an end-to-end system where everybody can see that data, and we often train patients between VAs and DoD facilities. So it'll be a great opportunity for caregivers who are doing that work to take better care of veterans and the active duty members and their families.
Right, and as somebody outside the veterans world, I do think that there are things you hear about veterans having problems getting in, timing, and I'm sure that's all going to get better. So congratulations to all of you. Thank you for your service, and enjoy the rest of HIMSS.
Thanks very much. Appreciate the opportunity.
Okay, everybody, we are going back onto the floor. We are meeting up with Daniel Lotsoff, who is the Senior Vice President of Digital Media Solutions at West, and he will be interviewed by Stephen Wellman, one of the people from HIMSS.
Hello, this is Stephen Wellman with HIMSS TV. I'm here at the West booth with Dan Lotsoff, Chief of Staff with West. Dan, thank you for joining us on HIMSS TV today.
Thanks, Stephen.
First off, Dan, could you tell our viewers here on HIMSS TV a little bit about some of the ways that West and its technology are helping to deliver better health care and helping healthcare service providers and other organizations improve the way they deliver to patients?
Yeah, so we're really focused on the end-to-end communication for mission-critical information, whether that be from a technology organization or from an insurance company to the provider, or from the provider themselves to the individual patients. That's really the area that we focus on, delivering technology solutions. On the provider to the patient side, we like to focus on things like when you are trying to communicate with a patient and you want to send them instant messages about their upcoming appointments, or for example, if you want to send them a survey about information about preventative care and appointments that we want them to be taking. We also focus with our IVR solution on the contact center space and improving the overall customer experience, patient experience, so we can improve upon that as they look to communicate back and forth between themselves and the doctors.
Communications is key to improving healthcare and delivering care. Could you show us a little bit about what you guys are up to here at HIMSS 19 in Orlando?
Yeah, sure. Why don't we go and take
a look
at the screen here?
Sure, let's go over.
So just as an example here, you see us on screen. So here at HIMSS 19, we are actually streaming from a news desk just outside the exhibit hall to all the folks that can't be attending this event. So if you think about it, at HIMSS, there's about 50,000 people that will be attending here physically in person, but there are probably 500,000 people that would love to consume this content. And so we're bringing the content from both the show floor, as well as the exhibitors and speakers and presenters, out to all these different audiences that can't actually physically be here attending in person.
That's great, and it's a tremendous service to the global healthcare community. Maybe we could just take a minute and drill into some practical use cases that you've been delivering for healthcare companies around the world. Could we take a look?
Absolutely. Let's take a look.
All right, let's head over.
So what we've got here is an example of one of our clients, United Healthcare. So this is their portal called UHC On Air, where they've made content available to all the different providers across many different states in the United States. So for example, when I first log in here, I'll see I have national news, this UHC News Now, so that's information that everybody in any state is interested in. And then I also have state-by-state news of information that only providers in those local areas would be interested in. So things specific about claims or enrollment, benefits enrollment, that may be pertinent to them. And then what we do in each of these different channels of content is we deliver the information in a television-style format. So for example, we'll combine PowerPoint with live streaming video to educate the audiences. Now what's fascinating about this is this information used to be communicated in person, and sometimes it would take an entire year to cover one topic. With our technology, what you're able to do is deliver that content in a matter of minutes, and obviously much more frequently over time. So a tremendous ROI for both the providers as well as the insurance organizations in this case as well.
Very interesting. Dan, if there's anyone out there watching HIMSS TV today that could not be at HIMSS 19, where would they go to find out some more information about your healthcare offerings?
Sure. So first you could come visit us at our booth here on the exhibit floor. We've got a lot of great experienced professionals here, happy to help explain our solutions and what else we potentially can offer. And then you can also always go to west.com to take advantage of all the great information we have available on our website.
Thank you so much, Dan, for your time. This is Stephen Wellman with HIMSS TV. Now back to Kate.
Stephen. Well, certainly it's been incredibly interesting to get this kind of range of people who are all working on the healthcare problem. You know, the military working alongside kind of the rest of the world and figuring out how best to do EHRs. And, you know, more and more I've just realized that, you know, the whole way of actually implementing technology, what an effort it is. And again, one of the themes and insights I've gotten is this idea of when one door closes, another opens. So certainly it's been clear through the interviews we've had that we are making enormous progress with EHRs, people getting through their MRAM scores, people who are actually paperless, and really beginning to realize the benefits of that, ranging from actually Major General Lee talking about what it's like to be in an emergency room on the front lines, actually being able to see someone's health record, I think is an enormous testament to progress of how we're doing. So certainly once this opens, now figuring out what to do with the data, how to make the data valid, it's all been a really interesting thing for me, especially as a chronic illness patient, understanding how many people are working around to make this better. I'm also an entrepreneur, and I think the other insight I've gotten from the people I've spoken to is that even though bigger medical professionals or whatever might look at entrepreneurial ventures as something that have a long way to go, they are enthusiastic about making them happen, and that is important to me personally as an entrepreneur and in general for change around the world. So with me now we have Governor Jim Douglas. He is the former governor of Vermont, the co-chair of the HIMSS State Advisory Roundtable, and Cynthia Green Edwards, who is the Chief Compliance Officer of the Michigan Department of Health and Human Services and the 2018 HIMSS State Official of the Year. I don't know what that means, whether you get a tiara or what happens, but congratulations.
I get the interview.
You get to do the interview with me. So let's talk about Governor Douglas. Let's talk about you being the co-chair of the HIMSS State Advisory Roundtable. Can you explain the rationale behind that initiative?
Yes, and one thing we do is present a plaque to our State Official of the Year, which we'll do at lunch today. Well, the State Advisory Roundtable is an opportunity for state officials to come together and talk about their experiences, to develop policy proposals for HIMSS, and to discuss issues of real importance to the health information and technology community. We meet quarterly by WebEx. This past year we've been focused on the opioid crisis, which is so pervasive and
in Vermont especially, right?
It's interesting that when I took office a number of years ago, I assumed it would be principally an urban problem, but in fact it's more pronounced in rural areas. Yeah. So indeed, and that's true in other parts of the country as well. So that's been our focus over the past year. Those roundtable discussions are on the HIMSS website, of course, for folks who might want to listen in. So it's a really great opportunity to share experiences, best practices, and talk about our mutual concerns.
On a state level, you know, you talk about trying to make change, and certainly one of the themes is you know, the high level, how hard it is making governmental change per se. Can you make change on a state level?
Well, I'm an optimist. I'm a state cheerleader because sometimes the federal government is ponderous and a little slow moving, and we of course ask them for maximum flexibility through the waiver process and grant making to facilitate change at the state level. But we did it back in 2005. We worked with CMS and HHS to get a global commitment waiver to focus our efforts on redeploying Medicaid dollars for preventive purposes. And a key part of that is having electronic medical records and making them interoperable around the medical communities of our state. So I really believe it can work, and there's a greater urgency at the state level. States have to balance their budgets, unlike the federal government, so they're constantly innovating and looking for ways to do things more efficiently.
Wow. Cynthia, you come from Michigan, so what are some of the trends that you are seeing there?
Well, it's all about the data, you know, and whether it's in my role as the Medicaid HIT director or chief compliance officer, even as a nurse implementing a pre-EHR.
Wow.
It was all about the data and the technology, and everybody thought, you can't do it. You can't do it at that level. And we have been able to prove to them that we certainly can, and we have been able to really work across disciplines, across health systems, in order to change the culture from not sharing for fear of competition to you can't be competitive unless you are sharing and working together.
Wow.
And so we have been able to implement a number of different initiatives that are taking that data a step further in putting it into practice, whether it's with a managed care from behavioral health and physical health and care coordination. It's containing specialty drugs or durable medical equipment, and also some of the management of high-risk populations. But we've also worked beyond just the Medicaid claims data. We have a very robust data warehouse that we have data beyond claims that we have been able to integrate together, utilizing our master person index and making that available to many of our partners and our plans, foster care, caseworkers, and local health departments.
So for your barriers, like the secret sauce of getting in and deciding like how we are going to make it work, what do you think that is?
Well, I think it's just an understanding of how you can make it work.
Okay.
So, I was in a meeting with a person who had not met me before, and he was a director of a behavioral health plan. And he slammed on the table and he said, we just need the data. And at the end of that meeting, he was overwhelmed by all of the ways that we could provide the data to him. And later on, he said...
So wait, it came in strong, and then you were like, okay.
And then he said, well, we're really going to have to think about this. And then he came back and said, we don't have the tools to be able to utilize the data.
Wow.
So we talked about some things of what they could use, and they ended up really making it a priority and understanding that they had to implement a system that they could actually utilize, and now they are one of the more advanced plans.
Well, I think that is such a good example of the way of the world. Data is king. Really? How's that going to work? What data do you want? What makes it important, right? And really kind of cracking into that level of how to make it effective, right? What are your thoughts with the, obviously Congress has changed, and from that level, from your perspective, how do you see the government playing out in terms of being helpful to you both on a state level?
Well, over the past 15 years or so, we've seen the creation of the Office of the National Coordinator for Health IT, and there's been bipartisan support for initiatives there. Some perhaps less than optimal progress in some areas, but a bipartisan focus on what needs to be done to get
Which
useful
is probably
data.
such a relief.
Exactly,
right?
Because this shouldn't be partisan, and we want to improve the health of the population of our country. Right. And there's always a hot button for anyone of a different ideology. For example, we've heard from our military leaders that we're not going to have a force fit to fight unless we improve the health and welfare of the military personnel. So that might be appealing to some folks. I think we can ensure that people are on the same page, and it'll save money, it'll improve people's lives. So I think we can work together.
Yeah.
And I think we've gone so far that we can't turn back. And so it's not a question of who's in office, what party. It's like what is the next level that we're going to take it to. And so I don't think that there's any issues with any of the changes. I think they're all very positive. There may just be different priorities at different times, but with the infrastructure that we have developed, we can accommodate that.
It's that whole feeling of, you're in it to win it, right? And,
exactly.
But how encouraging that you have kind of a nugget of actually seeing progress. And in the world of government, of which I'm not part of, so I'm, again, saying this as someone who doesn't know, hearing about progress on a state level, that in itself feels like progress.
Oh, it definitely is. And I think one of the major ways that we have been able to make that progress is we've developed trust with our stakeholders trust with the federal and the state government, that now we are able to move forward as, one entity as opposed to multiple separate siloed entities.
Yep.
You know, one of my favorite times at the National Governors Conferences was when we met privately without any staff, without any press, just letting down our hair and talking about our common concerns.
Right.
And they're quite common regardless of political party.
Yeah.
And that's a role I think that HIMSS can play through the State Advisory Roundtable, to be a broker of good ideas, to share best practices, to say, hey, something really neat happened in Michigan, maybe it'll work in Vermont.
That's right.
So
and actually we had Hal Wolf, who ended his talk with me, and he said, look, people come in with 3 questions and they come out with 6 ideas, and how helpful that is. Thank you both for being here and giving me faith about politics.
Keep the faith.
I know, thank you for saying that. Okay, everyone, so in my time before today, I had conversations with 2 wonderful people, Colin Hung, who is the social media ambassador to HIMSS, and Dr. Giannoli. Take a look. So we are here with Colin Hung, who is the social media ambassador for HIMSS. Colin, we're totally psyched to have you here because I feel like as someone who's online broadcasting what is happening here, you have to be involved and aware. So I'm super curious to hear what you've discovered amongst the 45,000 people who are here and what to talk about.
First of all, it's 45,000 people, but it seems like smaller because every 5 feet you run into someone you know from online or you know from past years. So it's a great family event, I find. It's like a reunion that happens, even though it's like 45,000 of us. But yeah, no, this year I'm excited. I'm always excited to come here to check out the exhibit hall and kind of what's going on because you get a macro view of all the different trends. And one of the biggest is definitely being patient engagement, patient experience, and the whole consumerization of health. I'm always excited to kind of see what companies are doing in that space, what's happening in that space. So that's what I'm hoping to see and have seen so far at the show.
Maybe you could talk a little bit about how consumerism is changing the face of healthcare, because really it's been happening for quite a few years now, and we're starting to see some changes.
Yeah, you know, I think at the beginning it was sort of a bad word, like consumerization of health, like what is that? But I think over the years, yeah, I mean, there's a recognition that the patient is an untapped resource in terms of healthcare, right? They own their care, they're probably the most responsible for their care, and a lot of care now happens outside the 4 walls of the institution.
Why do you think people initially had an issue with calling that a consumer issue?
Well, I think for a couple of reasons. One, I think consumers, it's sort of like, oh, I just use healthcare, I don't interact, because I think the word at the beginning was around, oh, like I buy something from the store, I don't have to interact with that store ever again. That was maybe the wrong, people thought maybe that analogy was poor. But as you go on, you kind of look at what the Amazons are doing, the Ubers are doing, and all these other companies, it's all around, no, it's not just a transaction, it's a whole life cycle.
What I want, what I need at the time I need it most.
It's about tailoring the offering to match your needs, to match how you like to interact, and tailoring that whole experience to it. I think that's the part that's morphed now, and that people are going, oh yeah, well that side of consumer I can get behind. The transaction part of consumerism, people are like, no, that's not healthcare. And they're right, like that's not what healthcare is. It's not a transaction, it's a relationship.
I think about the whole idea of patient empowerment, and certainly the age of the consumer, or making it more consumerist, is empowering. But I also think about empowering the patient as a patient and how to better their wellness while they're in the face of adversity. So can you talk a little bit about what you've seen on patients and how they empower each other?
Yeah, no, there's a lot of online communities, for example, that have sprung up on social media, whether that's through Facebook, or LinkedIn, Instagram, Twitter, of course. And it's just all around supporting each other. People are going through the same diagnosis, going through the same issues, even families of people who have chronic conditions. They're all banding together and supporting one another with resources, with links to specific clinical trials, all these kinds of things, which wouldn't have been possible without the technologies that we have today. And now, thankfully, some of the companies here at HIMSS are getting on board with that and are now enabling this. So actually enabling these communities to happen and be part of that care, because as you're saying, it's more than just the medicine in a lot of cases. You need that support. And that comes from just your fellow patients.
How have you seen it affect the people in your population? Because you've actually run a Twitter chat on Tuesdays, right? HCLDR,
That's
right?
HCLDR.
And how have you seen a concrete example of people getting better? Because I feel, I'm an entrepreneur that also brings together people to connect, that people feel better, and I think as a result of that, they are better.
Yeah, no, it's definitely the case. So on HCLDR, it's a real mixture of people that come to our community and our chat. It's physicians, nurses, administrators, patients, of course, health IT people. They all come together and we chat about very different issues in healthcare. Technology sometimes, leadership issues the other times. And one of the things we have noticed is that there's a strong patient voice. We have people like Jen Horonchev, we have people like Grace Cordovano, we have people like Amanda, LA Lupus Lady. They all come on and they give their perspective from a patient advocacy point of view. And they've done, each of them have done incredible things, helping other patients navigate the healthcare system. In Jen's case, she's created a co-op where she has brought patients together to get their expertise to product managers, to companies, to organizations, to bring that patient voice inside of healthcare. And that's just some concrete examples of how patients are now getting much more involved in the business of healthcare, not just in the sort of the consumer side of healthcare.
Right. Wow. I think that, first of all, your enthusiasm is amazing. As somebody who's a patient, it's really nice to see somebody, especially on social media, be so enthusiastic. And I think it's really important. So Colin, thank you so much for being with us. We really appreciate it. I can't wait to see you, whatever. You're going to be like floating on the ceiling by the end of this.
We'll be definitely online, and yeah, I'll be definitely floating around, tweeting and being alive, and you'll see some of the stories that we publish on Healthcare Scene.
Jeff and I are going to look for you late night. That's going to be like the big challenge, He's still going.
Still going.
That's great.
Still going.
Cool,
Awesome.
Colin. Thank you. Thank you. I'm here now with Dr. Thomas Gianelli, who is the Chief Medical Information Officer of the IHMI, which is part of the American Medical Association. Dr. Gianelli, we have to start with what the IHMI is. So,
thank you for letting me speak today. Nice to be here. IHMI stands for Integrated Health Model Initiative, and that's really working towards interoperability and what they call data portability standards.
Right, which has been a huge, huge subject here.
Absolutely, very important.
So tell me a little bit about this product that you are launching here at HIMSS.
So over the past year, we've developed a set of standards. The one that we're talking about today is related to self-measured blood pressure. So these devices that are proliferating in the ecosystem today all use different types of standards to send information in different formats. What we've done is created a standard that allows them to be aligned so that they speak the same language. They call it semantic interoperability. And so that the data can be collected, aggregated, and analyzed in a way that's uniform. The other advantage of our model is that we actually allow the signal-to-noise ratio to improve, given the fact that we capture certain information that improves the value of the information being captured. And that'll help the clinicians make better decisions. So it's really twofold: clinical validity of the data and also semantic interoperability, both solved by the solution that we're proposing and releasing today.
It sounds like certainly in all elements of healthcare that actually getting similarities of different systems to work together is crucial in terms of progress.
Right.
How hard was this to do in terms of bringing all these companies together?
Well, it's not easy. There's two problems within interoperability that we're facing today as a healthcare system. One is data liquidity. Liquidity is what I would call when you have data parked in silos and you can't really get that information to share. It's not liquid, it's stuck. So data liquidity has been the problem that healthcare has been focused on for probably about 10 years now with different solutions like CHINs, RIOs, HIEs. Limited level of success. However, given the recent introduction of FHIR, which is a really good transport for liquidity, as well as TEFCA and other initiatives around hoarding data and locking data, there's some Cures Act regulations that apply. We think that the liquidity solution will be addressed successfully in the next few years. Now, we're focused on data portability. So once the data is liquid, how it's phrased and structured is what they call data portability. So if you don't have portability that's interoperable, you don't tend to understand the information that's been sent. And so once you solve liquidity as a problem, the next problem is portability, and that's where we're focused.
Well, the other problem that I think has come up that you would think is a wonderful problem to have is getting all this data, and how do you actually pull the data that's most important to the top?
Right, exactly. Right. So how you organize information, how you structure information, how you search information, all has to do with the data portability standards that are applied. And that's again where we're focused, and we think that's going to become the #1 problem in the next several years.
So the American Medical Association has been this organization that has been around to help doctors, nurses, other people in the healthcare space kind of give their best practices.
Right.
How has technology changed their mission?
Well, the AMA has been around since the 1800s. It's a very old organization that's evolved over time, and today we're really focused on digital health. So digital health is probably the #1 focus for a lot of our new efforts. So it has to do with clinical validation of, say, medical devices, apps, approaches, and that's where a group called Exertia plays a big role. How that information around data interoperability is move the liquidity solutions. We have a partner that's through an AMA-related company called Curie that's focused on liquidity. We also have IHMI, which is focused on data portability, and other groups like Physician Information Network that allows us to bring the physician's voice into these new ventures and these new ideas to innovate with more of a physician perspective. So these are all areas that we're focused in.
Within this, these huge initiatives to kind of open it and use, kind of come in flow with these technical advances, how do you keep the personal side of care prominent?
Well, the AMA represents primarily doctors, but also represents patients. So we look at their best interests. That's part of our mission. And we approach a problem like interoperability. We look at what's the best solution for the physician side and the patient side. So in our case, we want to make sure that the signal to noise was improved so the doctor makes better decisions, which in turn is better for the patient in terms of their care. Right. So that weighs into everything we do.
You said you've been coming to events like this for 20 years. What are you most excited about this year at HIMSS?
I'd love to see the evolution of the marketplace, the solutions, the innovations that have been brought up maybe 2-3 years ago now forming
being taken
reality.
More seriously,
yeah,
right.
Actually having some traction in the market, seeing the market respond to some really good ideas and adopt them. That's what I find exciting.
Well, it's clear that there is a lot for you to look at here at HIMSS, and I really appreciate you taking the time to stop by.
Thank you as well.
With me now is HIMSS editor Beth Jones-Sanborn, as well as Stan Shaw, who is an MD, PhD, Associate Dean of Executive Education at Harvard Medical School, and John Halamka, who is an MD, MS, Chief Information Officer and Dean for Technology at Harvard Medical School. Thank you all for joining us here. I want to kick off because I happen to know you guys are doing an initiative with HIMSS, and I want to know more. Tell us about it.
Great, thanks so much. So for the first time ever, Harvard Medical School Executive Education has designed a custom educational program for HIMSS. And the purpose of the program is to move beyond the wonderful technology and innovations that you're hearing so much about at this conference, and to intentionally interweave all of the critical perspectives from inside the healthcare system that are critical for these companies and these innovations to ultimately meet with success. And for us, that success is not just a thriving business success, but also ultimately improving the care of our patients. And so certainly there will be many discussions led by experts like Professor Halamka on cutting edge technologies, but we're going to always interweave these discussions with perspectives of patients foremost, but also all the influencers and decision makers and ultimately users in the healthcare system, from frontline clinicians to physician leaders worried about physician burnout to physician executives. And our hope is that these critical perspectives will help the HIMSS community, the HIMSS executives, better function at a very complicated intersection and ultimately improve their strategic business success and ultimately improve the care of our patients.
Let me add to that. So here we are at HIMSS surrounded by 60,000 of our closest friends.
Right.
We've got, as you said, patients and providers and payers and pharma. We have industry and government. And the big question is, as we hear the themes of HIMSS, patient-family engagement, patient-generated healthcare data, the ONC and CMS rules that dropped yesterday. How do we turn that into product? How do we turn that into results? And so, as you say, we're putting together this multidisciplinary faculty of folks who've actually lived the dream. I have
lived the dream and the problem.
Yeah, so for 23 years, I have overseen all information technology at several Harvard hospitals. And that means I understand issues like privacy, usability. How is it we actually tailor a digital solution for my 81-year-old mom? Because that's different than a 22-year-old wearing an Apple Watch. And so this course will go through all of those variations on technologies and stakeholders and help our HIMSS community understand what is next and how to do it.
I think it's also interesting that this program is about executive leadership and education, because we hear all the time how much those roles are shifting. and evolving, and the traditional skill set or list of duties that were inherent with a C-suite role have changed. There's a lot more collaboration. Sort of their roles are less siloed. We like to use that word siloed a lot. And so obviously that needs to be part of the education, is understanding what the skill set was 5 years ago or 10 years ago, what it is today, and what it needs to be moving forward as well.
Oh, absolutely. Let me start with that one, because as a C-suite member for 23 years, I've watched my role change from I was a siloed technologist, go get the servers running, to now I'm a strategic member of the management team, deciding what interventions we'll make that, by the way, happen to include technology. But really, there are changes in workflow and process, changes in the way we actually deliver our product. Totally different skill set than having 14 programming languages under your belt as an engineer.
I think it's a really cool perspective that you've had, because I think that's true. Technology was an afterthought, and all of a sudden now it's becoming something that's such a bigger part of healthcare in general. Do you feel like, the example of the 22-year-old millennial versus the 81-year-old, that for compliance to actually happen, that is going to have to be individualized?
Well, absolutely. What comments you would make?
In compliance and just a broad range of patients, I think, if you take a step back, certainly we are going to provide perspectives across the wide variety of contexts of care, right? And so even though the program is at Harvard, we will provide concentric circles of leader influences to share their perspectives, so that the HIMSS executives know who is on the other side of the table and what ideas are going through their head, right? What are the problems keeping them up at night? And some of it may be specific patient populations. Some of it may be introducing a very diverse patient population to different concepts, different technology platforms, and their attitudes about it, right? So I think this is part of a broader executive leadership that, as John said, it's no longer just about the detailed technology capabilities or the platforms, but it's a position where it's a lever to execute on the strategic goals of the institution, the strategic goals of the clinic. And so they're always balancing competing priorities. And that can be different patient populations.
I think it's so important. That's something that's come up, this idea like, oh my gosh, you get so much data now, your life's going to get so much better.
Only if you know how to use it.
Exactly. And how do you pull out of that on what's important or whatever else?
Sure. So as you might know, 50% of doctors want to quit because they feel utterly overwhelmed by the digital health suite supporting their practice.
Which is so disconcerting when we're facing a physician shortage over the next 5 to 10 years,
And so we need to deliver different solutions that turn data into wisdom. And what do I mean by that? Say, let's see, you got a Fitbit? No? Okay, well, imagine that you sent me 10,000 normal blood pressure measurements. What am I going to do with that?
Who cares?
Other than being overwhelmed. So the question is, how do I turn the data about you and patients like you into action? And that's some of the things we'll discuss.
Well,
we're all facing this challenge.
That's right. Although then you could say, wow, now I have 10,000 points of data about this person, and if I shovel it up into the bigger world, maybe there's a way that we can look at it on a large scale and find, global health trends. But certainly the idea of actually helping medical professionals figure out
improving outcomes.
Improving outcomes, which is most important. I mean, even hammering down on the metric of the 30-day readmission, right? And more, like one thing that I've heard here is I think people are making progress. They have that little benchmark. They are all trying to find ways, and they're using it to show their success. And they are having success on that. But this is this whole thing of like, oh, that's so great. This little mini outcome you're getting better at. But it's now so expansive. And that's when I look at your role, right, of starting, like you probably got like the corner office with no windows. You were like that technology guy, right? Basement. All right, cue the cliche. And how that shifted, because the enormity of technology actually gets freaky.
Well, and cumbersome too, because technology advances may be faster than we're ready for. And so there are certain areas of it that struggle to catch up. And that can create challenges as well. Cybersecurity is a perfect example of that. You know, if we want to innovate because we want to help patients, because we want to get the best possible outcomes, and technology can help us do that. But you can't have other aspects of innovation running to catch up. It needs to move together to really be as effective as possible.
And some of this is driven by the customer.
Right.
Right. So we cannot do business as usual. Because the customer is saying, I will seek other providers of care.
People are paying attention now, right, in that regards.
Unless you offer me these tools and services.
Right.
We see data like that all the time, that X% of people said in this survey that they would be willing to switch from even their trusted provider to a new provider if that trusted provider didn't move with the times and offer this, and this convenience. You know, and I think providers are finally catching on to that, but then the question is, okay, well, again, how do I catch up?
Totally true.
Yeah.
I am excited about this program. It sounds like it has enormous potential to generate ideas. I'm so glad you got out of the basement.
Well, thank you.
Great job, and thank you for joining us on our show.
Absolutely, a pleasure.
Thank you. We are now moving on to a package with Geeta Nair, who I got to speak with yesterday, a physician, a corporate businesswoman with a lot to add. So joining me now is Dr. Geeta Nair from Topline MD. Dr. Nair, I'm thrilled to have you here. I have heard, we had a number of satellite events that have happened at HIMSS. One of them was about patient engagement. You were on a panel. What were the takeaways?
So, first of all, thank you so much for the invitation to be on the program.
Thanks.
I think the main takeaway is that patient engagement is really the quarterback to get us from fee-for-service to fee-for-value. Everyone has to do it. We're all struggling with it. And really, we discussed, how to get started.
I feel like with that subject that people got into healthcare because they were trying to engage patients. And now with all the kind of, swirling masses of change and chaos and protocol and regulations, that it's really hard to find that interim. Did you hear any insights that kind of cleared a path?
Well, we have to lead with the metrics, right? So we're in a consumeristic healthcare environment, which we've not been in the past. So the consumer is ready to text their doctor, they're ready to do a virtual visit, they're ready to go online and have a conversation with their physician in a way that they have never been before. So now we see vendors in the marketplace, Cypher Health, Carium, Allscripts, Radix Health. There's so much competition, which is fantastic because it means that we've got a plethora of solutions to pick from, and we have metrics to measure and move the needle on no-show rates, quality measures, mammograms, colonoscopies, you name it. We want our patients to come in and do it. I'm a doc, so this is what I want my patients to do. If they respond to a text, great. If they would rather do it as a virtual visit, no problem. Just get it done.
And actually being able to follow the process, that in the moments that they don't respond, of actually being so granular that you can really identify the problem spots.
Completely. And the other thing that we realize is, docs, we can't be with our patients 24/7. You don't want us to be with you 24/7, but you are for the most part on your device, whatever that device might be. So if we can meet you on that device for the times that you're not in the office with us, it goes a long way.
Well, it's funny because I did some research before you came here, and I came up with a quote that you once said, which said, when patients are engaged in their care, which means meeting them where they are on their mobile devices, they have better outcomes. So talk to me about what you have personally seen in that regard.
So it's common sense, right? The patients that come to me know that they have lupus, know what medications they're on, know their family history. They do better. They do better because we can be partners in care in a way that other patients who are like, I don't know, remember, what do I have again, doc? It's arthritis, something like that. I think I'm on the medication with an A. So we can have a better conversation and make a better care plan for them is really the name of the game.
I think about taking control of your own health. I'm a MS patient, and I feel like I did my own research and my own care, and now more and more people have the ability to do that. So what happens with a patient that doesn't, that still looks at you as kind of a white-coated person that knows the answer? And what expectations now do you have of the patient in regards and what's in light of what's happening in this world?
Sure. So, there's only so many tools that we can give anyone, right? But I'm a big believer in making your patient a partner. And when I say that, and when we talk about it in the health tech world, it's that old adage, you can teach a man, you can give a man a fish and he can eat for a day, or you can teach a man how to fish and he can eat for a lifetime, right? So I think as doctors, our job is to help our patients learn about their disease, learn about their treatments, be open to them, and also understand what it is in their lifestyle, their culture that works or will not work with the treatment plan So that's really what it's about. We can only come up with these tool sets, but you've got to understand why you should even be looking at them and using them.
Right, so it's almost, I mean, because that's, in theory, the incentive is actually understanding that you have power. Are there other incentives that you put into play?
Feeling good, feeling good, looking good. You know, my team, we're actually launching a podcast called Dr. YOLO. You only live once, make it count, right? So, I mean, whether it's the podcast, whether it's just life, you only live once. Why not make it count? Why not be healthy? Why not feel good? Why not laugh more? Why not walk more? It's all connected. The mind-body is very much connected, and the more we make people understand that, even when they're not sick. If you're in the hospital, I've already lost. I want to do everything for you before you even enter the hospital doors. And no smoking, drinking in moderation. You know, you've got to be able to have a real life and embrace your health as part of your life.
It's funny because I think about that idea of, you know, as patients, it's like, what do you want from your life? And often that the response is, I want to walk my daughter down the aisle. I want to see my kids graduate in high school. Exactly. And how interesting the kind of quality of life ends up being a quantifier in its own right.
You know, you just remind me of a patient that I had terrible, terrible lupus. And he would never take his medication. And his daughter got engaged. And that was what changed for him and me. And all of a sudden, he became a partner in his care with me. And he said, Doc, she's getting married, you know, in May. And he worked so diligently with me over the year. And he was able to walk her down the aisle. But what changed was not the medication, was not that, you know, anything different in his diagnosis. It was that he came to his appointments, he took his medication, he was just as incentivized as me to help him get there.
Wow, it's amazing. And it's really cool to hear that how you bring it all together, you know, in the quantity and the quality of life. Dr. Nares, thank you so much for being here.
Thanks for having me.
We're here now with Ursula Hubner, who is a PhD faculty at the University of AS Onstesbrück, and Beth Elias, a PhD FHIMSS faculty, University of Scranton, and Beth Jones, Scranton, my co-host. Ladies, we also have a tiger on the table.
Yes.
I'm just putting it out there. It's not an elephant in the room.
Usually it's the calling out the big pink elephant in the room. Today we have tiger, or actually three.
This is Toby. He's a mascot for the Tiger International Task Force. He's actually been the mascot of Tiger for many years, and so he, of course, goes with us everywhere. He's just a necessary presence for anything we do.
Yes, well, it's a beautiful way to lead in about the name of your organization and what it does.
Yes, TIGER stands for Technology Education Reform Guidance Initiative, and it deals with strategic approaches to improve education, health informatics education for all clinicians and all health professionals.
How much do doctors want to be educated? We've talked about them being so overwhelmed with data and having to learn all this stuff. Do they find getting involved is a helpful thing for them?
You mean physicians?
Yes.
Yeah. I think physicians are so challenged in today's healthcare system with the demands of patient care, the demands of continuing the education with things moving ahead so rapidly with evidence-based care, that part of our responsibility when we're looking at revising and revolutionizing education is to come up with ways that we can address their needs in a manner that makes it seamless and natural,
like non-invasive,
and non-invasive, so they don't have to actually necessarily stop what they're doing, leave their practice for an hour to go to a lesson. They can have somebody at the elbow, or they can have a system that guides them and helps them in a more natural way, just like using an iWatch. So we want the same kinds of processes in place for healthcare informatics, for healthcare professionals and administrators to support them in their work.
And after all, clinical work is all about data and knowledge all the time. And if you do it on paper, it's still data and knowledge. And if you do it electronically, it's just changing the medium. So it's
also increasing the pace, right? It's making things move faster. And on some level, that's a plus. And on some level, I'm sure, in some way, as you're dealing with more and more work and things are moving faster, it's harder.
Well, actually, I think a lot of healthcare providers would tell you that the IT actually slows them down. a little bit.
Right, because of the adoption.
The increasing demands of documentation.
Interesting.
And the time it takes to learn how to use the system, the time it takes to navigate systems that don't communicate with each other, perhaps having to have 2 to 3 different systems open at a time to get a full view of the patient. So I think we have a lot of opportunities as health informatics professionals to work with healthcare providers and administrators to smooth that path and make that more seamless for them so that we can keep up with them, basically.
We hear all the time about the onus of documentation on physicians and how you have physicians who are spending hours of pajama time, as they call it, at home, completing documentation and tasks just so they can either stay on schedule with their patients or maybe still eke out a couple of extra minutes with each patient. So certainly the need is there, but again, it's how do you integrate it such that you're not placing any further burden on a physician that is already so besieged by
and
change.
it's not just physicians, it's nurses as well. Nurses suffer from the documentation burden as well. And you know, there are over 3 million nurses in the US alone that are dealing with this.
Yes. Usability is in fact a great issue. Yes, things are not as usable as they should be. And this is where science comes in because researchers are needed to test and evaluate the systems and hereby improve the usability. And this is also how Tiger comes in, because usability is a huge issue within Tiger.
Have you guys, with your organization over time, actually seen usability improve in terms of the existing technologies, EHRs, et cetera?
Yes, I have.
Good.
Well,
I know, right? Victory!
Just think about the user interfaces in the 80s and the text and command line things where the users had to type in everything, and now it's going to be more and more voice supported. So there is, it's a slow process, but there is definitely improvements going on.
Good. Thank you for that little nugget of hope.
Yes, we all needed that. Everyone's breathing easier at this point.
So you guys are also presenting at a presentation that's a view from the top, is what it's being called. So what does that mean?
So a view from the top is an elevated education session, and it has more of a leadership and strategic focus. So the people that we're communicating with about the project that we've been working on are leadership not only in healthcare, but in education, vendors, across the health IT spectrum. So our goal is to help them understand ways that they can actually move that rock a little further uphill that you were just talking about.
Although every time you make a strategic change, then what happens? Then what happens?
More cascade,
right?
But things are always moving forward in life. We can't stop. We can't stop things.
Can you talk a little bit about the crux of your session and what you're hoping to convey to your captive audience?
Yes, right. So our strategic approach is to include both the global as well as the local perspective. And to measure the relevance and importance of certain health competencies, because it cannot be taken for granted that this and that core competency is relevant for everybody. And so we made a distinction for certain competencies, for certain roles, and this makes our approach unique. We are building upon what's already there, what's existing, but we are putting something on top. So it's the relevance that we measure. We do it on a global scale. We give it to the experts to say what is the relevance, and we have a lot of experts in our group. So in the first group, there were people from 21 countries. In the second round, it were 718 experts from 51 countries. So this is really the global perspective, strategic. On the other hand, of course, we need to look what's happening in the communities, and therefore we have the case studies, and maybe you can talk about this.
Second part of the project was to solicit case studies internationally. So the first part of the project was to do this development of competencies, global competencies that could actually be relatable on a local level. Then what we needed to do was find out, is what we're seeing in this these competencies actually reflected in the real world? Are we actually getting an accurate view of this?
Right.
So we solicited case studies internationally from 23 countries, I think, Ursula, 23 countries, and found that there was actually a very close alignment with the core competencies that we had developed through survey and experts and what people were actually seeing out in the real world. And so the purpose of the case studies is, and they'll be available on the Tiger landing page under the project page, is to help people see how these competencies are operationalized in the real world as exemplars and as gold standards, so that they can actually take that case study and say, this is what I can get from it, and this is what I can apply in my own local area.
Awesome. You guys are wonderful. Thank you for the Tiger and the work that you do. Good luck with your presentation.
Thank you.
Thanks for joining us on the show.
Thank you.
So as a solo entrepreneur, I certainly understand the power and need for community. And yesterday I had a chance to speak with Iris Fry, who is a HIMSS member who is building a community of her own. Take a look. My world is getting bigger. Joining us now is Iris Fry, the Director of Optum Advisory Services and the co-chair and co-founder of the HIMSS African American Special Interest Group, and Danielle Ciori, who is a nurse informatics specialist, who's also on the board of HIMSS African American Special Interest Group. And with me is Susan Morse, who is my co-host and editor of HIMSS Media. You two, we could talk about your work in data, we could talk about being a nurse and being a consultant, but we're not going to. I want to hear more about the Special Interest Group and what it is about.
Great. So the African American Special Interest Group is about a collaboration between the organizations that come to HIMSS and the African Americans that attend HIMSS. We want to build upon a foundation and have everyone come together and learn what the African American personnel, what they do and what the organizations do. So we can go further in the future.
Yep, so we partner up. And a lot of stuff, education. So I assist with doing like the social media, connecting people on Slack, making sure everyone has their memberships, making sure everyone signs up so they can get the emails out for the webinars. And I run the Twitter handle and the Instagram, and just really broadening the communication and basically broadening out throughout the world. So we have members that are in Africa, people maybe have gone to historical black colleges in health tech, and now they're living and working in Africa or London and France. And so I kind of gather everybody up using social media to pull us all together.
Right. And I know, Iris, you're a co-founder of this group, right?
Yes.
What prompted you to form this group? Did you have a certain incentive or something that came up that said, I need to do this?
Well, that's a very interesting story. I went to a HIMSS 6 years ago, and I walked around, and I kept on seeing the same African American faces. And I said, this is an event where you can learn so much education, so many networking opportunities. So why didn't I see the African Americans present? So I went up to somebody, and you know what they told me? They said, I don't see anyone that looks like me. I don't see any events that I go to that people that look like me are present. I don't go past the booth and the ones that are working there, they don't look like me.
You feel like a unicorn. Everyone, when they come up, they're like, I thought I was the only one. I'm the only one in my company. I'm the only one in my group. I'm the only one. And I didn't realize there were more of us to come together and do charity events, to come together, and what more can we do? And as you come together, you build more of a consensus, you build more of a body, and you can go forth and help each other out.
I can certainly speak to the whole idea of being a solo female tech entrepreneur, and certainly that feeling of loneliness that comes with, having a vision, having a dream, and kind of being in your own world, and recognizing on some level kind of the metrics are against you. And what I found in my experience is reaching out and finding other fellow female entrepreneurs, that it's a really powerful bond, and that women want to help each other. Right. Do you guys agree?
Definitely. I definitely agree. I do meet up with a lot of women all over the world because I travel about 30, 40 different countries. And it's so great when I find all the little unicorns and just started gathering everybody up and pulling everybody together and go, hey, I'm going to be in Finland, or hey, I'm going to be in Malta. Okay, let's meet up. What can we do? Where can we speak? Let's support this female-owned company, or let's support this, this gentleman that's created his own company and he's having his own booth, and he's only African-American having his own booth. Like, we all need to go and support. So I try to find the unicorns and bring us all together.
Right. How many members of HIMSS are African-American?
Wow. Now, that's a question that is hard to answer. Okay. I will tell you one aspect. At our session last year, we had almost 700 African-American members that attended our session last year.
Excellent. Both men and women.
Both men and women.
What's interesting you say about that is they actually added on the survey, because some people from Europe ask me, why are they asking my race, when you're signing up? And the reason why they did is because we request that to try to find all the unicorns and bring everybody together, let them know that we have a group, we're having webinars, we're having discussions, we're having meetings. So I get that question a lot, is why is race important? And this is a why, so we can pull each other together and use the analytics.
Right. Because diversity in the workforce is very important, because when you have diversity, you have a very powerful workforce. And we all
have more than one point of view.
Yes,
You see often business fail when they only have a singular point of view, but when you have multiple points of view that can see a different angle of the pie, that can maybe go, I don't think we should do it like this. I think I have a better way. We have a broader perspective of what's going on.
Yeah. What I think is cool about this, and Susan, I mean, I know you've been involved with this organization for a long time. When you come to a conference like this, there are people from so many different elements of the healthcare space, right? And that in itself gives a range of diverse perspectives, which is sort of what you're talking about, right? Like, what is the power of not only coming from, a different element of healthcare, but also having the ability to come together, let's say, finding your own energy, your own community, and having diversity within diversity.
Right, exactly. Right. Well, it is within numbers. Yeah. It is being comfortable. It is being able to have a voice. Yeah. And when you have a voice, that voice is able to say, this is how I feel. Yeah. Because sometimes you don't feel comfortable saying it to you, but they may feel comfortable with saying it to her.
I'm a nurse. Everyone says everything to me. I keep everybody's secrets.
And that voice may be very powerful and may take that organization to another level with their innovation, based upon the missions and the goals. So we are allowing that voice to be heard.
Yeah. So you two talk about the power of coming together. Can you think of a specific anecdote that would demonstrate that, an example?
I definitely can, and it is a personal one. It is about my own organization. I went to my organization and I explained to them what this group was and what it did and how important it is to sponsor it. And this is their second year that they have actually put us in a budget, and it's getting bigger and bigger. And I'm proud because today, we're celebrating diversity.
And what do you think brought to the organization? Actual awareness and more understanding, correct?
Yes, very much so.
That's great. And events, do you have any coming up?
Yes, we do. Yes, we do. So for the African American SIG events for this year, HIMSS 19, this is your organization and your events. We have a HIMSS Optum is sponsoring a HIMSS networking event tomorrow. It's going to be from 6 to 7 on the exhibit floor, and that's going to be booth 5979.
So that's on Tuesday, right?
Tuesday.
I'm sorry. That's okay.
Tuesday.
We're recording,
Look,
so that's good. Let's make sure we get it right. I want everybody to show up.
We
so
definitely
Tuesday,
want everybody to show
And what
up.
time is it at?
And it is from 6 to 7.
Okay, 6 to 7 here.
Yes.
At the conference center. That's awesome.
On the exhibit floor. And also what we are really excited about is IBM Watson Health is our speakers this year for our session.
Wow.
And they will be talking about next level thinking, breaking down the barriers, because that's what we plan on teaching the HIMSS African Americans. It's time to break down the barriers.
And all are welcome.
Yeah.
All are welcome.
All are welcome. That's great. Awesome.
And happy Black History Month, so we got it all.
Yeah, great, man. That's all great.
The time is from 5:30 to 6:30.
Okay.
In room W300.
And that's Tuesday as well?
And that's, no, that's Wednesday.
Wednesday, okay. You got a Tuesday event and Wednesday event.
We have an event on Tuesday with Optum and Wednesday with IBM Watson Health. Awesome. And afterwards, we have a free networking event with IBM Watson Health. So we want everyone to come out.
Bring your business cards. Bring your best smile.
Great.
And start
Well, you
networking.
guys have 2 of them. I'm just throwing it out there.
Yes.
I'm really glad you guys came on the show, and thank you guys for making the time.
Thank you guys.
Thank you. Ladies and gentlemen, we are going back onto the floor, this time with Stephen Wellman from HIMSS and with Troy Roberts, who is the Vice President of Customer Success and Enhanced Technologies at Fortinet.
Hello, this is Stephen Wellman with HIMSS TV. We're here at the Fortinet booth, and I'm speaking with Troy Roberts with Fortinet. Troy, could you tell us a little bit about what it is that you do at Fortinet?
Yeah, good morning, Stephen. We're excited to be at HIMSS this year. At Fortinet, we are one of the world's largest suppliers of global security systems, cybersecurity. My role is I run Enhanced Technologies and Customer Success.
Enhanced Technologies, that's pretty interesting. Could you tell our viewers a little bit more about what that means?
Yeah, Fortinet takes a fabric approach to security. We don't believe a single appliance, a single solution is all-encompassing. So we've created a bunch of emerging technologies that form part of the fabric, products that are created to work together to address all elements and touch points on a network to provide a very comprehensive network security solution. So things that might not have formerly been connected to a network, like telephony or video cameras, or sandbox, mail, SIM, wireless switching, those types of products we lump into our Enhanced Technologies portfolio, and my group runs that portfolio of products as we deliver that to the market.
That's great. Could you give us just a little more information about what makes cybersecurity different for healthcare? What are some of those unique challenges that some of our viewers at HIMSS TV and many of the attendees here at HIMSS 19 are dealing with?
Yeah, no, it's an excellent question, and we're really focused on delivering security without compromising patient care. We're really attempting to make cybersecurity simple for healthcare institutions. It's a daunting task, right, when you consider privacy, compliance, just the value of patient records, and having to secure all that. So we are making solutions that make it very simple for them to deliver very robust security and tie in maybe some of the other products that I mentioned before that weren't necessarily part of a cybersecurity solution in the past, part of it today. Because when you consider the records that we have to track and care for in a patient portfolio, we now have to incorporate that digital data and protect it. So telephone records, telephone calls, video surveillance, all become part of what we have to protect for patients.
Very interesting. I know you've been showing some of this security technology to the attendees here at HIMSS 19. Could we take a step over and take a look at some of the stuff you're demoing?
Yeah, absolutely. Let's take a look. So here we've got traditional telephony solutions, but as more devices connect to the network, telephony didn't used to be something we had to worry about securing, but now that it's all IP-based, we have to recognize that that presents risk to the network now, right? Anything that touches the network becomes a risk and a vulnerability, so we wrap security around that. We also know in today's world that telephone records have to be protected. I've got to store that voicemail as part of the patient record. It has to be encrypted. So that really becomes part of an overarching security posture. In this case, we're also showing what used to be traditional video surveillance, but we've taken it to the next level. As part of our fabric solutions around security, we've put in facial recognition. So now as people come and go, I can use facial recognition to tell me who that person was and then track their movement. So if I want to find out where Dr. Steven is right now, I can literally go to the console and say, show me the last camera that saw Dr. Steven. Or I can leverage object detection. We're detecting objects by intercepting that data stream and doing analytics on it. So if I'm looking for a wheelchair or a laptop or an infusion pump, I can make that part of the solution. I can make that something that I can search, find an empty wheelchair, get it to a patient, really increase the patient care that we're delivering through a hospital. Tie that in with my telephony system. Now instead of just dialing Dr. Stevens' extension, I can push a button and find his location as well. So it's really starting to bring some of these peripheral solutions together into a very comprehensive solution.
It's all very interesting. Thank you, Troy, for walking us through that. Just kind of one final question. How much more a blending of the kind of traditional peripheral security and technology and heritage technology are we going to see coming in the months and years ahead as that begins to get picked up by these kind of traditional network security type solutions?
Yeah, that's the interesting part of today, right? Is these solutions used to be handled by the physical facilities group or somebody else. Now that they all touch the network, we're seeing that flow to the Chief Information Security Office, right? That has to be part of a comprehensive security solution. And today, there are more devices being plugged in than ever. So think of all your Internet of Things devices, your operational technologies. There's something new touching the network every day. That's where it becomes part of what we're delivering as a security solution to make sure that healthcare customers are safeguarded regardless of what a customer, a patient, a partner plugs into the network and potentially introduces new risk to the network.
Troy, thank you so much for the detailed demo here and showing off for our viewers on HIMSS TV. I'm Stephen Wellman with HIMSS TV, here with Troy Roberts from Fortinet. Back to you, Kate.
With us now is Keith Bigelow, who is the General Manager of Analytics and Artificial Intelligence for GE Healthcare. Keith, you, I believe, have a platform?
Yes. Yeah, we just introduced Edison, and it's our intelligence platform for precision health. So if you think about every device that GE makes, we make about $19 billion a year in revenue, so every single X-ray, MR, CT, mammogram, sonogram, everything we create. We've created this platform to make each and every one of those devices and the software that supports it smarter. And this is our mission. It's probably a 10-year mission to bring this intelligence across every medical condition that we can, across all our devices, to bring about better health.
So before Beth asks the question, I want to know, is the software actually bringing together all the data from each one of your machines into one pool of data, or is it making each device smarter?
Wow, that's a great question. So what we do is we work with hospitals to pull in data. So for example, we recently filed with the FDA an algorithm for X-ray, and its job is to detect when your lung is collapsing. It's called pneumothorax.
Wow.
And we needed lots of hospital data from different hospitals in order to teach the algorithm that the way you take an X-ray is actually different at different hospitals, or you're using a different manufacturer. So the whole idea here is bring in as much data as you can with as much variety as you can so that that algorithm gets really, really accurate.
Wow.
And I know you mentioned earlier that this technology is already saving lives. So of course we want to know about that.
Absolutely. So I mentioned in Q4 we delivered a series of algorithms to the FDA, and some are already approved. So one of the recent ones that is pretty impactful emotionally for me is for women who have in their uterus a growing embryo. And at 20 weeks, you normally do an ultrasound test to check on the health of that embryo. This new algorithm actually will measure the volume of the brain of the infant, and we have work ongoing for checking the health of the heart as well. So you can imagine that across the world, because we have tremendous share and we're in about 160 countries, we're going to start helping mothers to know the health of their child and how to intervene earlier to raise healthier kids. FDA approved right now.
So it's funny because I feel like the FDA gets a bad rap solely for the reason that it takes forever to prove things. So how is actual technology going through an FDA differ from, let's say, a clinical trial and a medicine?
So interestingly enough, an algorithm is a medical device.
Okay, wow.
So if this is our X-ray and we want to run lots of different algorithms, each one of those algorithms will go through the FDA process to get 510K, or in Europe, CE marked.
And for you, obviously, your present is super exciting. Talk to me about the vision GE has. What do you guys do? Scheming around the table.
Right.
We have done great work. We have algorithms that are actually making progress. And now we hope that in 5 years, and in 10 years, and in 20 years, what happens?
Right. So right now, the example I gave you with X-ray or with women's health ultrasound, single modality, where the operator is getting a better image and taking better care of that patient, right? Over time, we're going to start moving into suites of algorithms. So I mentioned fetal brain and fetal heart. You'll start to see those expand. So that's near term, 1 year, 2 year. When we go out further, now start thinking a care pathway. So if you have cancer, God forbid, you might actually have scans by MR, by CT, by other modalities. And we want to pull that data together, so multimodal, so that we can drive a better outcome for you and actually share across the algorithms knowledge of each one of those scans.
Yeah.
And that'll get us closer to precision health, where the combination of your scans and your in vivo tests, like your DNA tests or your pathology tests, your blood tests, will bring all of that data together to prescribe the perfect thing just for you or just for you, but they won't be the same anymore like they are today.
Wow. Right? You feeling that?
Yeah.
Yeah.
Definitely, especially when he was talking about the potential impact to the health of a fetus, of a growing child, because we hear all the time about the ridiculous rates of infant mortality in our country as well as other developing countries as well.
Yes.
So, I mean, something like that, really, the possibilities are endless.
They are huge.
Yeah.
We're super excited to hear about it and hear more about Edison in the future. Thank you so much, Keith, for being with us.
Me.
All right.
Thank you.
Okay, I'm super impressed.
I'm really
that really works out. Although I do think that it's really hard to be perfect. I know he said we're going to get you the perfect treatment and the perfect. I appreciate the whole idea of precision medicine being precise.
Right.
But I think there's a deeper philosophical question about being perfect.
Well, and here's the thing too: is does perfection leave room for evolution, for change, for something that shifts in the last minute or mutates? You know, I'm not a doctor; I don't know all the clinical terms, but I think perfection can actually be confining.
Yeah.
A little bit as well.
Right.
Yeah.
That's right. And continue to go on.
Yeah.
With us now is Karen DeSalvo, who is the former National Coordinator for Health IT and Consumer-Directed Exchange. Oh, you're a Consumer-Directed Exchange advocate. Hi, Karen. Welcome to the show.
Hi, it's great to be here. Thank you all for having me.
So where are you looking in terms of your focus at this event? What is exciting you the most?
Oh, thanks. You know, I am really excited about, first of all the energy and conversation.
You can feel it, right?
Oh, yeah.
It's
and
palpable.
the sense of urgency about, okay, now we have the foundation in place with this great digital underpinning. So now how do we really focus on the consumer, make it work for them, make the marketplace transparent, make it so that they not only know what they're buying, but what the choices they have are, and really empower them. It's an important evolution of this work to flip it. It's not about the doctor or the hospital, right, or the systems. It's about the people that we're serving.
Yeah.
So what are some of the first steps you feel that a health system can actually take that would put the consumer in the driver's seat?
You know,
a little loaded. I know. They would all say, and I would say as a doctor and any system I ran, we always put the person, the patient, the consumer at the center. But in reality, it's difficult to do for a whole bunch of reasons. And we saw some of that story play out with the patient portals and the journey of trying to get health systems to create an electronic means of people to communicate with the health system was a struggle. How much have the patient portals actually been successful? Because certainly you can offer these amazing technologies. Do people actually
use them?
Do they pick them
up? They use them when they're sick. They use them as they're aging and they have caregivers, children, family members that need to look at labs and upcoming tests. So what we find in the data and anecdotally is that we don't really want to interact with the health system very much. We really don't. We want to be people, not patients.
Right.
And so those portals are designed more for you as a patient. And we also ended up in a world in which we have hyperportalosis. So we have lots of different places we have to go to get our data, which is why the policy and the technology and the business trend now is to put all that data in one place so you can have it on a single app on your smartphone. And that way it becomes at least easier to navigate. I really, honestly, the next generation though, you're seeing with what the work that like Apple is doing, where they're making it more part of your life flow.
Yeah.
It's the watch that I'm going to wear. It's my smartphone. And they're the beginning. Google will get in the game and everybody else. So I'm not having to go to a special app or log on to a special website. It's just something that I might even see in my newsfeed. Like, oh, by the way, don't forget your mammogram's due. And click here so you can schedule it. That's the technology opportunity that we have to really not make you, again, feel like a patient, but more like a person, and we want to make this as seamless as possible for your life.
Meet the patient where they are.
Absolutely.
You know, the last thing quickly is I feel like you've always heard, oh, let's put the patient first in terms of their care. But I do think there's a discrepancy between being a patient and being a consumer. Right?
Yes.
Who is a patient, and I think that's where the where things are really beginning to shift, and that's hard.
People, it is difficult for a lot of reasons. One, consuming healthcare isn't exactly like buying a car or choosing a new pair of shoes.
It can't be.
No, it's much more complex.
It is it's super complicated, and I think what we're learning though is definitely that more information's better, and people are expecting and demanding it. So the whole transparency movement will help. I think we also have to acknowledge and recognize that people want to be met in different places. They're where they are in the journey of their health or sickness, that they have all these non-medical issues that drive their health. There are things like social isolation, food insecurity, life that's happening to them in their work, et cetera.
Of course.
So really beginning to have a more nuanced picture of somebody, not only again as a patient, but as a consumer, because there's going to be different places that you might want to offer them services, maybe more virtual matters.
And how they live.
That's exactly right.
Karen, thank you so much for being on the show.
It's great to be here.
Thank you. I think the idea of being a patient versus a consumer, when you think about other industries like, banking or, that it has been much more clear about how you spend your money. And how do you actually split that from how do you treat your health? Because that's what needs to change.
I mean, those are two different realms, two different mindsets. I'm in a much different mental place when I go on my online banking app than I would be going on a health app. Even if I was just checking something routine like entering my blood pressure so my doctor can see it for that day. That's a different mindset. It's a different emotional
100%,
state
100%.
As well. So we do need to maintain a line and a respect.
Cool. With us now is Jen Horonjeff, founder and CEO of Savvy Cooperative. It's so nice to see you, Jen, in person.
Yeah, thank you so much for having me. Very excited to be here.
I have actually been in touch with you in the past with my startup, and I love what you're doing. So explain to the world what you're up to.
Yeah, well, I'd be happy to. So Savvy Cooperative was really born out of the experiences of patients and the fact that all these products and services that are out there aren't necessarily designed with patients in mind. And so what Savvy does is we help to connect companies, researchers, or innovators directly with patients so they can actually work together to co-create new solutions, so we can stop guessing what patients want and need and actually ask them and really create better products and services that meaningfully impact a patient's life.
And you also, whether or not it's actually co-designing or actually being part of clinical trials, one thing in your model I think is amazing is that you can offer opportunities for patients to make money.
Yeah.
And I think that's huge because I think patients feel taken advantage of in some way. They make assumptions that people in the healthcare space are spending, taking their money. And why shouldn't they get compensated?
Well, that's really what we're trying to restore, that power imbalance, right? That the fact that we don't exist without patients. Healthcare is here to serve them, but yet a lot of the models are very extractive. We're taking their data, and it's fine if it's helping other innovations, but people are profiting off of it. So we're just trying to make sure that patients are also valued for their time and expertise, the same way we value statisticians and doctors and designers. It's just another area of expertise. And that's something that we do as an organization as well. We're actually a co-op. We are collectively owned by patients. So that means that they have a voice in our organization, and the profits that we make, we share back with patients. We're trying to practice what we preach.
How much value do you feel patients feel today about if you say to them, look, this is an opportunity for you to share your data so we can learn more and maybe get a cure? How much do you think that still incentivizes patients?
Well, I think it's still an incentive. we shouldn't say that patients are just out here for money. That's not the point that we're trying to make. Of course, people want to further this agenda and find cures or make advancements. But oftentimes, if we aren't fairly compensating patients, it's actually a diversity issue. If we're only talking to individuals that have the time to take off of work or could get a babysitter or otherwise, then we could be perhaps only innovating for a certain subset of the population. So we just want to make sure they have that ability.
And missing out on really valuable information and insight as well.
Yeah, absolutely. And I think something that really we forget is how meaningful it is for patients to be able to use their experience and to be part of this process. If you are diagnosed with cancer or chronic illness, your life could be stripped away from what it used to be. And this is just a way to then use that experience for good. And we really want to give more people an opportunity to do that.
Real sense of empowerment coming from 100%. The ability to do that,
And I want to throw it out there, it's healing. For sure. So, Jen, it's so great to meet you in person. Keep doing the work you're doing.
Thank you. And our little savvy puppet came to say hello, too. So
I'm glad.
We need to make sure that they're out here.
That's great. We will look for the puppet in the future. Watch out for the tiger. There's one on the side.
I saw it.
Be warned. Be warned.
Dangerous place. Thank you so much.
Thank you. So I certainly, in my experience with my startup, have really believed in the knowledge of what patients have in terms of what they know, and that sometimes, patients that are debilitated or whatever else, people make assumptions that they can't contribute. They can't contribute. So there you go. With us now is Tom Skelton, who is the CEO of SuperScripts. Tom, welcome to the show.
Hi. How are you?
We're happy to have you. And tell us about SuperScripts.
It's SureScripts.
I beg your pardon?
That's okay.
Well, I'm sure they are super. I'm just throwing that out there.
They are super, but it's
We were
SureScripts.
improvising. Thank you.
Right.
And SureScripts is a firm that was founded to stand up the nation's e-prescribing infrastructure. We were founded in 2001, and we move a couple of billion scripts a year. And in addition to that, we work with physicians and patients to help ensure that information is provided that really delivers actionable intelligence to the point of care.
How has that process changed over the years that you've been in business?
Oh, it's been
You're like,
amazing.
how much time do you have?
Right, it's been a fabulous journey. I've been doing this now for over 35 years.
Well, tell me how it started in the beginning. No, for real, and where you are now.
Sure, if you go back, it used to be you got a piece of paper, and you carried that from your doctor's office to the pharmacy. You handed them that piece of paper, and then they eventually got you a prescription. You stood around, you waited for that, and you're not feeling well, you've got the script coming anyway, so you've got to stand there. What this does is everything that we're doing puts that information in front of the patient, so the patient experience is that much stronger. The latest offering related to this is really about bringing price transparency to the point of prescribing, which is a major change. So, I'll tell you a quick story here to help. I have a relative, she's in her 80s. It's a situation where she goes to her prescriber and she learns that she needs this script. It's got a big copay associated with it, too big. She gets to the pharmacist, she doesn't really want to pay that much money. Now she's caught in what we refer to as a secondary workflow. She's talking to pharmacists, talking to prescribers, calling payers, calling PBMs. This is designed to take care of all that. What this information does is at the point of care shows the prescriber, Tom Skelton's in front of you. Tom's plan for this drug and for this pharmacy is going to cost Tom this much. Let Tom know that. And by the way, here associated with that are some therapeutic alternatives in case that isn't the best solution. The other thing it does is it shows them if there's additional paperwork that needs to be done to get this script and can save a lot of time, energy, and money that way as well.
Really, it's the patient should be the last person stuck in the moment having to make calls to
And this is where the lack of transparency about pricing is so confusing to understand. Who is fighting against you to lay out the true price points?
What I would say is we're not seeing that type of difficulty in the market. I would say quite the opposite. We've seen faster uptake on this product than anything we've introduced before, and we've been doing this for 18 years. We've got a significant number of prescribers using it, over 115,000 at this point in time. We're doing about 6 million transactions a month, which is up from only 300,000 in January. So this thing is growing in a really, really big way. One of the other things that I would call out is not only is there savings in terms of time that gets associated with this, but truthfully, there's big savings for the patient. We've identified some extraordinary circumstances where individual scripts were saving patients upwards of $8,000. So massive, massive benefit to the consumer here.
That's tremendous.
Wow. That kind of fills me with a sense of support. I mean, a sense of just, when you talk about the age of the consumer, that is a really great first step. So
it is. This is
really
a big first step, and we hope we open the doors to a lot of other places in healthcare.
Yeah.
Me too. Great. It's great to have you on the show.
Great.
Thank you
for
so
your
much.
time. Appreciate it.
Thank you.
Cool. Great. I love that because I feel like for some reason that's just not clear, ever.
Well, and you hear so much about drug prices not being transparent.
Yeah.
And so to hear him say that they didn't get much pushback.
I agree.
I found that actually really surprising when you hear so much about a perceived lack of transparency and who's setting the prices. Is anybody hiding them? Right. Who's hiding? It's been such a contentious dialogue.
Yeah, I totally agree.
Yeah.
With us now is Michael Sears, who's the CEO and founder of 11 Health. Hello, Michael. Welcome to the show.
Thank you. Thank you very much for having me.
Tell us a little bit about your organization.
So, 11 Health...
and your accent, by the way.
Okay, well, I escaped London to come here.
Good. Okay, good job.
And I got the weather, so it was good. It was very good. But 11 Health was built by me from a hospital bedside. It's a company that focuses on patients living with long-term conditions that are attached to medical bags. So at the moment, we focus on the ostomy, people that have had colorectal cancer or inflammatory bowel disease. And what we do is we turn effectively a dumb bag smart, and we put intelligence and sensors in the bag, and then remote monitor those patients from the data that comes off the bag.
What do you learn in the bag?
Yeah.
So we learn, for example, one of the highest reasons patients like this are readmitted is dehydration. So we can tell how much is coming off the bag, how much is coming out your body, and when it's coming out. Patients, 90% of patients like me have big skin and wound issues because you've got something attached to your body. So we can pick up temperature changes, we can pick up infection markers and things like that. So we're in a very unglamorous end of healthcare, but sadly a high patient need.
Absolutely.
So you lived this from a personal experience.
Yes.
And
indeed.
Tell me the play-by-play, because I think it's always interesting. I'm a fellow entrepreneur who lived a problem with MS. When you had the problem and where the moment was that galvanized you to start a business?
So I had Crohn's disease as a kid, and I ended up becoming the 11th intestinal transplant patient in the UK. And I had an ostomy, and the bag leaked and spilled, and my surgeons were going, but we need the data, and you'd manually empty things, and it was like, okay, we can do better. So I went out to the patient community and just said, what do you do? And the answer was get used to it. So I hacked a sensor, not very good, and then was lucky enough to get initial funding, came to America 2.5 years ago.
Wow.
And built a company from there. So I'm very passionate, as I'm sure you are, about patient-led innovation and sort of the role that patients can play in healthcare.
Well, it's amazing to live a problem and to really, so the problem that in my world is loneliness, right? When you have that moment of diagnosis, and more it's now being proven that loneliness kills. And certainly with your issue, you're dealing with the whole physical stigma of dealing with a bag or whatever else. But what I think is amazing about your story is actually tinkering away, and
badly.
Yeah, so what? But it worked. I mean, minimum viable products, are they ever good?
Absolutely. And listen, I think as a patient, you can't wait for innovation to happen. You've got to get on and do it. And
right, when you're told your other option is to get used to it, well, who wants to get used to that?
Exactly. So let's just get on with it.
Exactly.
And I think your bit about emotion, we use patients who are living the same condition as health coaches.
Yeah.
So to buddy up and support other patients, I think that's almost more important than the tech, to be honest.
It's really nice to meet you, man.
And you.
Congratulations.
Thank you. Lovely to meet you.
All right, thanks for being on our show.
Thank you
Take
so
care.
much.
Yeah,
Bye-bye.
thank you. Amazing.
I can't imagine being on the receiving end of you just have to get used to it.
Yeah.
As a patient with everything that's supposed to be available in our innovative society, and that's
well, in and itself, what does a doctor say to you in a moment of emotional vulnerability is a whole other conversation, and frankly, they're not trained to say something that could be a little more constructive. So there you are.
Yeah.
Up next is Samita Mishra, who is a PhD, MHA, PAHM, and the Director of Population Health for Northwell. Hi.
Hello.
Did I get that right?
Yes, absolutely. That was a long introduction.
Good. I know. It's all the creds makes you very impressive.
Yeah.
Before you even open your mouth. So population health is something that has come up a lot because I think technology has really allowed scale to happen and being able to derive insights that affect a whole group of people. So how are you working to do that?
So at Northwell Health, we are definitely pioneers. We try to be the first in trying out anything new.
Good for you.
We certainly try to make an effort to see how technology can be an enabler rather than making lives miserable for the physicians. So the idea is, if we are really looking into triple aim and trying to support the quadruple aim, which is also physician burnout and physician dissatisfaction, how do we make technology available to them as a tool versus something that takes them away from direct patient contact? So the idea is to have ease in deploying technology that's useful, that's easy to use, that takes efficiency but also empathy into account. So we are trying to do that by engaging physicians to be design partners, by engaging patients to be design partners, which kind of automatically segues into patient engagement tools. We are also trying to understand exactly what is needed from a business case perspective, from a clinical use case perspective, and convert that into a roadmap, which can be dictated by regulatory requirements, can be dictated by shifting priorities. So when the technical team is coming up with all these digital solutions, or our vendors are coming up with these digital solutions, our idea is, guys, this is a roadmap, this is what we want to accomplish, but guess what? It's dynamic, it's not static. We have to shift gears based on needs, based on requirements to meet the ultimate factor, which is improving the patient experience and the quality of care, keeping the cost down.
Well, how's it working out to actually get all of those great ideas and that roadmap through regulations?
It's definitely a daunting task ahead of us, but that's what makes it more fun. We live and learn every single day. We are certainly doing baby steps at a time. We're trying to figure out what works, and we pivot if it doesn't work, and sometimes we're trying to cut down on redundancies. Like I'm meeting all these vendors. They have amazing innovative stuff, but how many vendors can possibly be there and that we can manage in a comprehensive way?
Well, it's the same thing about doctors. If they're given a whole bunch of solutions and you think that's so great, I mean, it's the problem that you're trying to avoid, right?
Exactly. So
too much.
Exactly. So basically, the pain point for doctors has been clicks. The pain point for doctors has been delay in the patient encounter because they are entering too many stuff into the chart. They are trying to read too many screens. So while all these technologies certainly make sense, we have to keep a balance between what's actually going to increase the efficiency and also the patient's experience, by improving our digitalization of patient engagement tool, patient experience tools. So it's a good balance that every organization has.
And it's progressing, so that's great. Sunita, thank you so much for being on our show. Good luck.
Thank you very much.
Roadmap.
Appreciate it.
Thank you.
Awesome.
Yeah.
So yesterday I had a chance to speak with Graham Grieve, who is the founder of FHIR. We talk about all these big data and how to share it, and Graham has an answer. Joining me now is Graham Grieve, who is the product manager and community lead for FHIR Standard. Graham, I'm thrilled to have you here because more and more in many of the conversations we've had, we've been talking about the importance of sharing data, and FHIR seems to be a crucial element to that. So why don't you explain to the world what you are?
Thanks for having me here. FHIR is, first of all, a community of people who want to agree about how to share data so that we can make it easier to break down the silos and help improve healthcare. And then as a community, we produce this formal standard, which we publish as the FHIR standard through HL7, the standards organization. And it's a set of rules for how any software can exchange data about healthcare.
How hard has it been to have people who have these silos of data to get them to start to share it?
So it's a cascade of challenges. The first challenge is to get them interested in sharing. My characterization of the vendors is that the vendors are really interested in sharing patient record data. They now recognize that there's no value in trying to block
holding
that.
It, silo it.
The business value is to be able to leverage sharing data. So they come to us and say, we want to share data, explain to us how. But then after we've figured out how we can share data, then it has to flow through a cascade of actually developing the software, testing, implementing it, getting it out to the users, the providers, and then the providers making the same decision. Do we want to share patient record data? Why would we do that? How do we leverage doing that? And so that's a cultural change that unfolds over a multi-year period. And we're kind of in the middle of that process right now, and so you're hearing a lot of glass half full, glass half empty thing about how it's going, because it's going really well in terms of pushing it out there, but the end user's going, it's not going that well yet, because they're not seeing it get to the end of that process.
It's funny to hear more and more about kind of the push and pull. I mean, you started with EHRs and like what a monumental task it was to start bringing them in. Now they're in. There are some people that have gotten all the way, up to a 7 on the MRAN scale. Things are working great. But with every implementation comes this whole new world of new difficulties.
Yeah, look, it's primarily an economic problem. How do we leverage previous sharing work to reuse it? The more reuse we can get, the cheaper it is to share, and the more we can get the business benefits without having to pay the cash for that. And so primarily you have to think about it in economics. Do you get your bang for your buck? And so the more aligned institutions are in terms of their formats and their data rules, the easier it is to share data. But there's a limit to how far we can go, because these products that we're rolling out, they're highly configurable. Yeah. Every institution makes their own rules. Institutions running the same software can't share data because they make their own rules.
Right.
And so even once everybody's running the standard formats, they still got their own rules about how data works and what the business rules are, and so it'll be an ongoing process. We'll stand on top of the first mountain we built and look up and say, hey, there's a much bigger one to climb.
All right.
I tell you what, the FHIR community, which I have the pleasure of leading, we're never going to be out of work.
Do you feel, in light of your experience in this world and what you see in the future, are you a half full or a half empty guy?
Well, I guess I'm a half full guy. I had the vision that let's go and do this. Everyone came on board. It's pretty exciting to see what's in progress. Yeah. And I can see people going, it's not there yet.
Yeah, hurry up.
But from my point of view, if the glass never gets to being half full, it'll never get full. And so I'm definitely a half full guy. Let's go do this. Let's make progress. Let's celebrate what we have and knock down the challenges we have left.
And in the world of technology, iterate, iterate, iterate. It's part of the game, right?
That's
Nature
right.
of the beast. So.
But I think more an underappreciated thing is actually collaborate rather than just iterate. Iterate collaboratively. It's the power of the group. Yeah. As far as not my work, I just happen to sort of preside over a big, thousands of people who contribute to make this happen. Yeah. And it's that ability to grow. And so we really depend on the partnerships we have with other professional organizations to seed and grow that work. Which is why I'm here at HIMSS.
Well, I hope I get to see you next year and you get to tell me more and more. Thank you for joining us.
Thank you, Kate.
Joining us now is Carrie Hedges, who is the Senior Vice President of Commercial Markets and Enterprise Data Solutions at Blue Cross Blue Shield Association, and Laurent Rotival, the Senior Vice President of Strategic Technology Solutions, as Chief Information Officer of Cambia Health Solutions. You guys welcome. Bienvenue. In your opinion, how are health plans enabling clinical and healthcare claims interoperability?
So I'll start representing the Blue Cross Blue Shield Association that represents all the Blue Cross Blue Shield companies around the country. We cover 1 in 3 Americans across the nation. And with that, we take our responsibility to enabling access and affordability in healthcare. And interoperability, as we heard earlier this morning, is one of the key components to making that happen. And we believe very strongly in really 3 things that help drive that. One is the patient being at the center, having that patient focused and knowing that the patient can enable really the better outcomes and the affordability in healthcare and bringing the patient to that point. The second piece is built around standards and having the standards to create the interoperability, like HL7 FHIR standards that we were talking about offline. And then the next area is really around bringing all the people together around healthcare, that we have the entire healthcare ecosystem working together to bring interoperability and to have access to the data. That's how we're going to actually change the way healthcare is delivered.
Right.
What I would add is that what Carrie is outlining is exceptionally important. I mean, we've been working for probably over 15 years now for ways of releasing data, making data available to individuals. I think as we can all sort of relayed at an individual basis, the healthcare system is just a mess and incredibly difficult to navigate. Yeah. And if you do manage to be lucky enough to access your data, it's very hard to interpret it. And so the work we're doing with the association, both at a national level as well as a regional level, is not only to release that data, but also particularly to make it important that the individual owns that data. Yeah. It is not the payer, the health plans, it's not the health systems, it's not the government's data, it's the individual's data. Yeah. And that data should not be constrained by the identity of the individual, either as a member, a patient, or an employee. Yep. But really, regardless of geography, they should be able to take that wherever they go. Totally. And then, of course, our ability to innovate. I think this is the exciting part about this conference, and particularly about what was announced yesterday on the CMS rules, is that we are going to be releasing a level of innovation that I think we haven't seen in healthcare for a few decades now.
Can you, for the people that don't know about the rules, explain what was actually said?
So the rules basically are on two fronts. One is eliminating the blockage, any kind of basically false reasons, right, that any healthcare institution would actually prevent the data from being accessible. The second one is fundamentally adopting standards, HL7-based FHIR APIs that allow any individual or any third party that is empowered or permitted by the individual to go access that data in the same way that you would expect in retail, for example, or outside of healthcare.
Wow, it's a really big change.
So in the context of the Blue System vision for data interoperability, what are you up to with consumer engagement?
Go ahead,
you know, a small question.
Teeny tiny.
Just a few things.
Just a few things, right.
Well, you know, Cambia, as well as the Blue Cross Blue Shield Association and many of our Blue Cross Blue Shield plans have been very active in a number of different things. We have a long history with WEDI X12 in the past, but really, you know, more recently with HL7, board members on the Caring Alliance, founding partners as part of the Da Vinci Project. We are really committed to bringing that forward, and then bringing not only the interoperability through the standards and bringing the different parties together, and doing so in a public and private partnership way, where it's not about any one stakeholder, it's not about any one organization, but it's about bringing the different entities together. And I think Laurent has some great examples of how they've been able to do that.
Right, well, you know, we've been betting on this happening. Now, if you had asked me a year ago, not to mention 3 years ago, I don't think I could ever have predicted that CMS and the government would actually, on a bipartisan basis, propose a rule that is so in favor of consumers. And so what's exciting for us is that 3 years ago we started advocating through the Alliance of Karen and a number of others. And in parallel to that, we started investing in resources. So as you look at outside of healthcare, whether it's you know, Airbnb or Amazon or any of the companies that we admire and use every single day, we've been building capabilities internally to actually start, on the assumption that this data would be liberated, that we could actually start building applications, solutions, mobile-based conversational mobile apps, where any individual would be able to download that data, right, on the basis of these rules. And then, of course, once you have it, is how do you make sense of this stuff? It is extraordinarily complex. As you've already gathered from the few comments we've made, there's a lot of standards and technical complexity. And so what we've been investing in at Cambia is really how do we develop deeply intuitive, personal applications that, how can I say, help the individual sort of parse through that data, only surface the data that's relevant at that particular point in time for the individual, surfaces it not only in the context, again, of their identity as a member or patient, but on a lifetime basis. We all have life events, and at the point of that life event, it would be nice to have a smart, proactive partner that gives you good advice so that you can make decisions early.
And you know, I wanted to just add one more thing to that, and that's around underneath this, it's about the trust, and it's about the security and the privacy for the patient as well. And so all of this needs to be done with that sort of in mind.
But it in itself, the fact there is change on a level as big as Blue Cross Blue Shield is probably going to make people trust you more. So
exactly right.
I'm excited for you both. Congratulations.
Thank you.
I know it wasn't you personally, but congratulations. And thanks for being on our show.
Appreciate the opportunity.
Thank you very
much.
And now a word from our sponsors.
Technology-enabled solutions that move your communications into the future. Patient engagement solutions that support you in solving the complex communication challenges associated with patient experience, patient care, patient access, and revenue cycle management. Digital media solutions that help you target the right audience, communicate across multiple channels, and monitor the impact of your messages. Visit us in booth 659.
It has been an amazing day one of the HIMSS conference.
Incredibly exciting.
I feel
so much energy.
I feel enlightened. There's a lot to still learn, so stay with us tomorrow. And now let's have a word from Ben Choder, who is the president of West DMS.
Thank you, Kate. Great show today, and I hope everyone enjoyed today's live programming, improving patient experience through every interaction, including access to information and communication, is the key in ensuring patient satisfaction. We've heard some innovative ideas on how technology is driving this change and look forward to hearing more over the next few days. Don't forget to join us tomorrow at 9 a.m. Eastern for our second day of live programming. We'll see all of you then.